Faites l'appel, s'il vous plaît, Madame le greffier.
Monsieur le connétable de Saint-Hélier. Madame le connétable de Saint-Laurent. Monsieur le connétable de Saint-Grelade.
Présent.
Monsieur le connétable de la Trinité.
Présent.
Monsieur le connétable de Saint-Pierre. Madame le connétable de Saint-Martin. Monsieur le connétable de Saint-Jean.
Présent.
Monsieur le connétable de Saint-Clément.
Présent.
Monsieur le connétable de Grouville.
Présent.
Monsieur le connétable de Saint-Ouen.
Présent.
Monsieur le connétable de Saint-Marie.
Présent.
Monsieur le connétable de Saint-Sauveur.
Présent.
Monsieur le deputy Southern. Madame le deputy Labbé. Monsieur le deputy Tadier.
Présent.
Monsieur le deputy Luce.
Présent.
Madame le deputy Dublé. Monsieur le deputy Morel.
Présent.
Madame le deputy Lehegara. Monsieur le deputy Ayer. Monsieur le deputy Ward.
Présent.
Madame le deputy Alves. Madame le deputy Gardner. Monsieur le deputy Ghost.
Présent.
Monsieur le deputy Farnham. Madame le deputy Moore. Monsieur le deputy Mezet.
Présent.
Monsieur le deputy Balash.
Présent.
Monsieur le deputy Cole.
Présent.
Madame le deputy Poré. Monsieur le deputy Ward.
Présent.
Madame le deputy Miles. Madame le deputy Scott.
Présente.
Monsieur le deputy Renouf. Madame le deputy Curtis. Madame le deputy Falcon.
Présente.
Madame le deputy Binet.
Présente.
Madame le deputy Jeune. Madame le deputy Miller.
Présente.
Madame le deputy Howell. Monsieur le deputy Binet. Monsieur le deputy Ferry.
Présent.
Madame le deputy Kovac. Monsieur le deputy Curtis. Madame le deputy Ward.
Présente.
Madame le deputy Wilson. Madame le deputy Stevenson.
Présente.
Monsieur le deputy Andrews.
Présent.
Monsieur le doyen.
Notre aide soit au nom de Dieu qui a fait les ciels et la terre. Amen. Seigneur Dieu, Père éternel et tout-puissant, qui a établi les gouvernements et les puissances de la terre pour le règlement et pour la conduite du peuple, et qui nous a commandé d'avoir toujours pour but la gloire de ton saint nom. Nous te prions qu'il te plaise de donner à cette assemblée le don de conseil et de prudence, d'unir les affections de tous ceux qui la composent, de les conduire tellement toi-même par ton Saint-Esprit que toute leur délibération est accompagnée de ta bénédiction. Réussissent au bien-être et soulagement du peuple qu'il te plu de commettre à leurs soins. Car nous t'en prions au nom et par les mérites de ton Fils bien-aimé Jésus-Christ, notre Seigneur, qui nous a enseigné de t'invoquer en disant: Notre Père, qui es aux cieux, ton nom soit sanctifié, ton règne vienne, ta volonté soit faite sur la terre comme au ciel. Donne-nous aujourd'hui notre pain quotidien, et nous pardonnons nos offenses, comme nous pardonnons à ceux qui nous ont offensés. Et ne nous envoie pas en tentation, mais délivre-nous du mal, car à toi la règne, la puissance et la gloire, au siècle des siècles. Amen.
Madame le connétable de Saint-Laurent.
Sir, the Connétable de Saint Laurent is still recovering from an operation. Could I ask that she be declared as malade?
Vous jurez que Madame le connétable de Saint-Laurent est tellement indisposée qu'elle ne peut pas assister aux états sans exposer sa santé.
Malade.
Monsieur le connétable de Saint-Pierre.
Défaut.
Madame le connétable de Saint-Martin.
So the Constable of St Martin's is still mallard. She hopes to be able to join by teams tomorrow, but today she's mallard.
Vous jurez que Madame le connétable de Saint-Martin est tellement indisposée qu'elle ne peut pas assister aux états sans exposer sa santé.
Malade.
Monsieur le deputy Southern.
Présent.
Madame le deputy Labbé.
Defoe.
Madame le Député Doublé.
Present.
Madame le Député Alves.
Present.
Monsieur le Député Farnham.
Defoe.
Madame le Député Moore.
Defoe.
Madame le Député Jeune.
Present.
Madame le Député Kovac.
Present.
Les États sont constitués.
Sir, I have a funeral to attend, if I may, later this morning, sir, but I will return immediately after lunch.
Thank you, Honourable. Honourable One.
So I'd just like to advise that I won't be here after lunch. I have to take a close relative to a medical appointment, but I hope to attend on Teams later. Thank you.
Thank you very much.
So just to advise that I hope to attend a funeral around lunchtime. I may not be in my seat straight after. Thank you.
Thank you very much for letting us know. We resume the debate on the 28th Amendment. Deputy Wilson.
Good morning. Thank you, sir. I'd first like to say to members that this amendment is not contrary to some belief circulating that we are reopening the debate on assisted dying. It's about whether an assisted dying service should be prioritised and funded with public money when the Health Minister has confirmed that currently core health services are under-resourced and in need of multi-million-pound investment. When it comes to managing scarce public resources, our social care system often gets overlooked, particularly the provision of respite care and the support available to carers. They are our unsung heroes, and between them, they provide invaluable support to hundreds of vulnerable people every day. So the purpose of this amendment is to ask ministers to consider this in a bit more depth and commit to redirecting the £2.7 million earmarked for a new assisted dying service into delivering much needed respite care and a service for carers. On a matter of principle, sir, it seems we may have galloped ahead of ourselves by assuming that the only way to deliver and fund an assisted dying service is by the state. In some countries, that is not the way assisted dying is done, and by deciding it will be state-provided as well as state-funded, we are immediately opening up a can of worms that we haven't given sufficient thought to. The scenario poses a number of questions. Should our health service not be better prioritising health? Do people want the decision about ending their life to be in their own hands or in the hands of the state? And what priority do we give to carers and those in need of support? There is an argument, sir, that because of the narrow criteria we've set for the eligibility for an assisted dying service, we can expect that the numbers for a population of our size will be small and at the lower end of the range somewhere. And so the cost per patient on the basis of this proposal is to be questioned. If Jersey allocates nearly 2.7 million a year to assisted dying, the cost per patient, depending on the uptake, ranges from £64,000 to nearly £400,000 per patient. And we must be honest about it. If ministers tell us that there's no new money, then as an assembly, we have some strategic choices to make. Do we spend 2.7 million on the many who want to live well, a core purpose of our health and social care system, or on a small number who are making a very personal choice to have their assistance with their death? Right now, sir, because of funding, carers cannot get regular breaks, respite beds are rationed, specialist respite for children is stretched beyond capacity, and many families are simply exhausted. If departments are constrained and must take proportionate cuts, as ministers have warned, then unprotected services will fall even further behind, unless this Assembly acts responsibly. And I would say to the Social Security Minister, maybe she doesn't need to commission a review into the needs of carers, because if she and her colleagues support the amendment, the money will be right there in the budget to spend now to improve the lives of carers and those in need of respite care. I am surprised by the decision taken by the Council to propose funding a service development which will place us even higher up in the OECD index for health expenditure, and this suddenly doesn't correlate with better health outcomes. If £2.7 million is approved by the Assembly to spend on assisted dying, it will also place us in the highest expenditure bracket for publicly funded assisted dying services, on the basis that we're likely to see between 2 and 38 deaths per year. So the proposal put forward by the government to spend money in this way is a statement of political choice. It says this is what we value, this is what we'll pay for, before we will pay for anything else. Yesterday, ministers themselves set the context for why this amendment is important. The Treasury Minister told us yesterday there's no new money. The focus must be on driving efficiency and making savings. The Environment Minister stated we must take all proportionate costs. We've looked hard at the choices. And most starkly, the External Relations Minister told us Western economies can no longer afford to finance healthcare in the way that they are. It is going to be impossible to fund what health needs. So these are not my words, these are the government's own words, and they go directly to the heart of this amendment. If ministers tell us these things, then the Assembly must seriously consider how best to use £2.7 million of public money. And there is a basic strategic logic to be considered here. We cannot, on the one hand, be told that the public purse is exhausted, that efficiencies must be found everywhere, and that even health needs may soon be unaffordable. And then, on the other hand, spend over £2.7 million on developing an assisted dying service for a very small number of people. So I'd like to move to reference the connection with the CSP priorities, which are very often quoted, back to members. And there are key risks associated with using money in this way. Any system that requires fixed annual staffing, clinical oversight, advocacy and IT systems, regulatory frameworks and communications, regardless of uptake, will always be proportionately more expensive in Jersey. No other small jurisdiction has made an assisted dying service cost efficient. Palliative care, respite and home care services remain underfunded in the island. If assisted dying is fully funded, these will remain incomplete. The CSP ambition is to support carers, strengthen community care, reduce hospital pressures, improve end-of-life dignity. It is undermined, not advanced, if we choose not to support carers in the way I'm proposing. The risk is clear and they are not theoretical risks. It's exactly what disability rights, hospices and palliative care organisations have warned against. And we need to listen to this. We're not immune from the consequences of introducing a state-funded assisted dying service. But we can do more for our carers and provide more respite. Countries that fund assisted dying through the public purse rely on three main arguments. It's part of end-of-life care. It's a small cost in the wider health budget. It ensures equitable access. But the international evidence shows that there are serious problems with these justifications. The counter-argument to its part of end-of-life care is that assisted dying is not a treatment. It has no therapeutic aim, and it's not comparable to palliative care. So the equal treatment does not logically stand. It's a small cost. This is where the major warnings emerge. In Canada, costs have risen sharply. Oversight bodies have struggled. Palliative care investment has not kept pace. And several provinces now warn that medical assisted dying is easier to access than many other health services. It promotes equity is the third argument. New Zealand, Belgium and Canada argued that public funding prevents assisted dying become a service only for the wealthy. But disability rights groups and palliative care organisations now argue that equity in ending life is meaningless if equity in living with dignity is not met first. And equal access to ending life is not morally equivalent excuse me, to equal access to support people to keep living. So this is a critical point for Jersey. We do not have the palliative care capacity we committed to. We do not have a respite system that meets the demand. We do not have full carers support in place. And yet, we are proposing to fully fund from the public purse the option to end life. This assembly itself required palliative and support services to be strengthened first. We have not yet met that condition. It remains incomplete. Carer support reform has stalled, and as I've said before, respite care remains chronically underfunded. So this amendment ensures, or aims to ensure, that those commitments are honoured before a new service is built. If the Treasury Minister says there is no new money, and the Environment Minister says department must tighten their belts, and that even health needs may soon be unaffordable, then how can it be justified to protect millions of pounds for a brand new assisted dying services, while carers, families and palliative services go without? If this Assembly accepts those warnings, then the logical step is to prioritise the services that sustain life, support carers and reduce pressure on the health system today. The European Court of Human Rights has been absolutely clear that there is no right to die under the European Convention, so assisted dying is therefore not a mandated public service. It is a choice created by this Assembly. And if it is a choice, then funding it ahead of essential care is a political decision. It's not a human rights obligation. And I urge members to think carefully about the political choices we are making here today. I'll come back to disability rights groups, because they warn that assisted dying services could provide a perverse financial incentive if ending life becomes cheaper than supporting it. State-funded assisted dying creates a moral hazard where limited care options can push people towards a legal alternative they would not otherwise choose. State-funded dying has the potential to cause systemic neglect, where scarce resources fall further behind as funding and workforce are directed and diverted to new service developments. We already know that the hospice and other palliative care providers operate on tight budgets. Introducing a new resource-intensive legal framework without simultaneously boosting respite care, palliative care, is not a neutral act. It's a risk multiplier, and this amendment is trying to address that. So we've already heard that the ministerial warnings, but it doesn't seem the case that these concerns are shared by all. Where is the evidence of objectivity? Where is the focus on sustainable healthcare? Any sign of humble recognition or reflection that maybe this may not be the right time to fund the service in this way? We should ask, why have we been presented with only one option as to how this development should be funded? Why haven't the Council of Ministers called for other options to be considered? What financial assessment was done on affordability? How is the decision justified on a service that supports a few but provides little benefit to the many? So I want to be clear, when ministers warn that it's impossible to fund the health needs faced by Ireland at this time, I couldn't agree more. But at a time when other health priorities are competing for resources and carers can't even get a weekend of respite care, it seems the Council have done nothing to challenge the fact that the amount of money identified to establish a state-funded assisted dying service for a few people is unaffordable, and engage the Assembly in discussions about alternative options. It seems, sir, that we are presented with a fait accompli. It is a problem in itself that we do not have reliable, up-to-date figures for how many islanders need respite care, and I hope the Social Security Minister is intending to address that issue as part of our review work. Government material consistently cites around 10,000 unpaid carers on the island, but formal commissioned respite capacity is tiny by comparison. Recorded in scrutiny reviews is only a few dozen beds and a limited community hours, even on conservative assumptions. If just 5% of carers require regular scheduled respite, that implies we need guaranteed respite for up to 500 islanders. Yet the formal supply is measured in dozens. Until we can close the data gap and scale respite provision, it is reckless to commit millions of public funds to a new service while hundreds remain unsupported. So this is not about choice at the end of life. That right has been debated and decided. It is about responsible budgeting, and it's an uncomfortable discussion to have. Members can support the right to assisted dying without supporting this particular funding model or its timing. This amendment does not block future implementation. It does not reopen the assisted dying debate. It does not change the law, but it does redirect money now where it produces the greatest benefit. It simply asks for what the ministers themselves asked for today: careful choices, proportionate prioritisation, and a responsible use of public funds. This is about responsible public finance and essential care. Do we spend 2.7 million on a service used by the few, or on respite and palliative care used by hundreds? Do we expand an optional service or strengthen essential ones? Do we follow the logic of today's ministerials or previous days' ministerial statements, or do we ignore them entirely? So I urge members to support the amendment. For me, it puts carers first, it puts dignity in living before the funding of dying, and it ensures that we meet our obligations to support life before we fund the option to end it. I move the amendment, sir, and open the debate. Thank you.
Thank you, Deputy.
Sir,
Is the amendment seconded? Thank you.
sir, may I raise the defo and Deputy Farnham?
Members content to raise the defo on the Chief Minister?
Lift the
Raised.
defo
Deputy
on
Moore.
Deputy Moore.
Sorry?
The defo on Deputy Moore, please. Can I lift the
Yes.
defo?
There you go.
Thank you.
Members content to raise the defo on Deputy Moore. The defo is raised.
Sir, can I raise the defo on Deputy Labby, please?
Members content to raise the defo on Deputy Levy. The defo is raised. Deputy Doublé.
Thank you, sir. And I just rise very briefly to point out that I am chair of the Assisted Dying Scrutiny Panel, and we are very much in the middle of a very thorough review into the recently lodged legislation. Part of our review is looking at the funding of the assisted dying service. And whilst I support the intention of the Deputy in terms of increasing support for carers, I do feel that I need to abstain for this particular amendment because I don't feel it would be appropriate for me to make a conclusive statement given I'm in the middle of a review at this point.
Thank you, Deputy.
I would like to ask point of clarification, Deputy Doublé.
Do you accept upon clarification? Yes.
Would the Deputy Doublé advise if the panel would consider the funding mechanism, and if required, would they consider to bring an amendment?
That's certainly something that I could put to my panel, but I must make members aware that there is already a massive volume of matters to consider. We're already looking at amendments to the legislation and trying to give the material the thorough consideration that it deserves. And it is something that is a considerable workload already for us. So that might be tricky, but it's certainly something that I could put to my panel.
Thank you, Deputy. Deputy Howell.
Could I ask a question, please, sir? If we debate this now, would this detract from the work that the panel is doing? Can they bring this back with their panel if we discuss it now? Thank you.
Question for whom? For the Deputy Doublé or for the proposer?
The Deputy Doublé, sir.
I don't think it would necessarily detract, sir, but yeah, my decision to abstain is because I am scrutinising the matter and choose not to comment on the funding at this time until we've concluded our review.
Yes, Deputy Gorst.
So I do wonder if that question from Deputy Howells was really for you. If whatever the states vote today,
yes,
that vote cannot be replicated should the panel wish in the time period that standing orders disallow the same vote again.
Yes, that must be right, yes. Does anyone wish to speak on this proposition? Deputy Barbara Ward.
Thank you, sir. It's just a point of, in some ways, clarification of what the proposer has said today, and to give members some background information, if it would be helpful. The original health contract for funding with a local palliative care facility was negotiated and agreed during 2022, and it was agreed by this Assembly and negotiated by the then Health Minister, Deputy Wilson, herself, which that agreement commenced January the 1st, 2023, at 2.5 million each year for 3 years, plus a further 2. The 2.5 million was a fixed amount with no growth over that 5-year period, which would end in 2027. This contract was then renegotiated back in 2024 with a new commencement date of October 2024 to cover increasing staffing and service shortfalls. The new deal was as follows. It was a pro rata sum from October to December 2024, an increase of £800,000. That is from, in addition to the 2.5 million, which raised the yearly sum to 3.3 million from January the 1st, 2025, each year going forward, till the end of 2027. There was a further inclusion, in addition to the extra £800,000, by way of an uplift of pay increases for their staffing, of which there is 100 people employed in this facility. This financial uplift of 3.3+ million a year by Health provides some 43% of funding with the on-island palliative care facility, which leaves them to raise the remaining 57% of their budget from fundraising and retail activities. This financial improvement by Health demonstrates the partnership and recognition for palliative and end-of-life care, which enables further development of services. These being engage, develop with the palliative care team, improve engagement with Health, with improved choice and use of palliative care beds. This further development is to improve provision for patients' choice of where they wish to spend their end-of-life journey, rather than on an acute, busy ward at the General Hospital. Investment with the engagement of a doctor, provide a 50-50 cover for the palliative care facility, in addition and assisted by another doctor. Develop the bereavement service work by going into schools, and the provision of an off-site bereavement counselling services to a wider service need. Continuing a 24/7 connectivity service support by Specialist UK Palliative Care Facility for overnight complex issues. Early intervention service at the time of diagnosis. Establish a living well team by engaging 5 extra qualified staff, and that was launched this year, sir. Engage an education community practitioner to liaise with the health educational staff at the General Hospital. Engagement of a nurse to liaise, work with Health on educating doctors and staff on breaking bad news to patients and their families. further development and discussions with the UK Centre of Excellence for an improved model. I feel what we've demonstrated by what I've just relayed to everyone is that health is trying very hard to meet its commitment to invest in palliative and end-of-life care via this partnership and increased funding. Therefore, we need the need to transfer monies earmarked for assisted dying, in my view, falls away. However, in light of what I've heard from the scrutiny panel, is that they are looking at that, which I'm pleased about. So I can't support this amendment at this time and ask you to vote contra. And I hope that the information I've relayed to you does show that health is really trying very hard to invest in our palliative and end-of-life care services, ongoing until 2027 at least. I hope that is helpful, members. Thank you very much, sir.
Thank you, Deputy. Deputy Feltham.
Thank you, sir, and I'm pleased to speak after the Assistant Health Minister because as Social Security Minister I think it's important within this debate that I clarify what support there is for respite that already exists. As people are aware, I have undertaken to have an urgent review of carers so that we can spot gaps and improve provision where appropriate. That particular review is funded from existing resources within my department. We're also working collaboratively with the health department on that, and we're drawing together existing strands of work. So that does not require additional funding at this point. But within this work, one of the most disconcerting things that I find as Minister is when people don't understand the support they can get and therefore don't ask for it. In response actually to this amendment, there was a piece I think some members may have heard today on Radio Jersey this morning, which I think is a really useful case study to help us understand this issue. So for those that didn't hear, there was a local pensioner who provides daily care to her husband, who said that she wasn't eligible for any government support and didn't get any. I'm pleased to say that my officers will be in contact with that person today to ensure that she knows exactly what she can get. But I can confirm that support is available today for somebody in that situation, if for somebody who is caring for their partner or another loved one on a daily basis. They will be eligible for the LTC scheme. The person talked about not being eligible because they had savings, but the LTC scheme does include support for everyone, and if they do have savings, they can receive support after a waiting period. It's really important that people understand that no one has to sell their house in order to get this support. If people are asset rich, but don't have the cash, there is a bond scheme available. But what is important to note here is LTC will support a care package in someone's own home. And that includes when carers helping the family and ensuring that no one is left caring for 24 hours a day without being able to have a break. A care package could include carers coming in on a regular weekly routine, with some of the benefit kept back to cover the cost of a longer break every now and then. The person also spoke about the need for carers recognition, and that's something that we're working on within this review. It's something that we hear again and again from carers, that actually it's not necessarily cash that's the issue, it's recognition of the vital role that they play. But looking forward, we do know that we need to invest in better respite facilities, and that's where some of the gap in provision is. I don't think that this amendment solves that issue. It is something that we are currently working on, and that will take more time to achieve. But it is important to also recognise that LTC can provide respite care in the home, and exactly what was described actually by the carer on the radio, where she said, I actually just want to go for a break in a hotel for a night. That is exactly the type of thing that is currently funded through LTC. We will also connect carers through Connect Me to community groups so that they don't feel isolated and alone. So with regard to this amendment, it is unclear how giving extra funding to Health and Care Jersey will help resolve issues. When it comes to respite care specifically, that is already funded via the LTC fund. So for me, the key issue that I'm working on trying to resolve is people's misunderstanding of how that fund works. It really does worry me, sir, that there's people out there that feel that there isn't help and support available and they're not contacting the department on the basis of a misconception. And I would encourage everybody who thinks they should be eligible to contact the department. So one of the things that we are hoping to implement early in the new year is a key contact point within my department for carers. So they have a key staff member who will be able to join the dots around government and ensure that they have the relevant support in place. We are also going to put together a comprehensive directory of existing government and community support for those receiving care and carers. We're going to do that in short order, sir. We'll be improving information on the website. We will also be providing information on paper as well. I know that not everybody can access information via the internet. Not everybody finds it easy to search our government website, and it's really important that we've got information on paper available for people as well. So there is ongoing work. There is financial support currently available. My concern is that due to people misunderstanding what isn't available, people aren't actually getting the care and the respite that they actually can access. And I just wanted to say that early on in this debate, because I wouldn't want this debate to exacerbate those misunderstandings, sir. But I renew my commitment as well to work hard with carers and support organisations to ensure that we make sure that we have the right level of support in place for all. Thank you, sir.
Thank you, Deputy. Deputy Tadier.
So when Deputy Wilson brings propositions to the Assembly, she does it in I think, a very thoughtful and well-researched way, and I think that's what we've seen again this morning. And we have to also remember that the area of assisted dying that inevitably is being in some ways redebated here, I think that's not the intention, is one of conscience, sir. So we'll start my remarks with that in mind. I was prompted to speak when I heard about the idea that an assisted death is not a human right, sir, and that may well be the case at the moment, but I am moved to say that the area of human rights is, of course, always in development, and if we look at one other area, which only 2 weeks ago the European Court was asked to rule on, it was a case about same-sex marriage. Now, same-sex marriage we take for granted nowadays, I think, in Jersey, although that was a hard-fought norm to establish, and it's not one that is even universal within the EU. There was a recent case where a Polish couple, same-sex couple, were married in Berlin, and Poland doesn't currently recognise same-sex marriages. Maybe something that needs to be raised with the Polish consul over here, and see what she thinks about that. But the point is that Poland was told that they had to recognise same-sex marriages that were solemnised in other EU states, even if they didn't have an equivalent in their own states. So at least for the purposes of freedom of movement, the enjoyment of family life, that Polish couple who remain Polish nationals should be able to enjoy their European rights within their home nation state. So things are in development. And I do I also turn to the area, for example, of IVF, so fertility treatment and access to it, which has been another area of great interest in this term of office for the public and for states members. Again, there is no universal approach in the world, or indeed in Europe. So, for example, one might be very surprised to hear that otherwise liberal countries, which we usually associate as being liberal, such as Germany and Switzerland, restrict who is allowed to have IVF treatment to heterosexual and married couples. So in Germany, you have to both be heterosexual and married to be able to qualify for state-assisted IVF, and the same is the case in Switzerland. These are things which would probably be, I think, largely anathema to us in Jersey and maybe even in Great Britain, which values us, which has a different view maybe on fairness and equality, sir. But we accept that there are different starting points. And the reason I bring in IVF here is that I think that when we look at health provision, I think it very much is cradle to the grave. So my concern in this debate is that it seems to be pitting palliative care against assisted dying unnecessarily. I don't want to have to do that, and I want to, as a citizen, sir, I want, if I'm in a situation of facing a perhaps long and painful death which I can't recover from, that I know I have all those options, both of those options available to me, which the state will support, which I hope when I'm older, that I never need, of course, but that if I do, I hope that those will be human rights. I hope that we will have a right to both have dignity in palliative care and dignity in assisted dying, if that's the way we choose to go, because ultimately, whose life is it? It is surely a fundamental area of autonomy, sir. So I am uncomfortable by this debate. I don't think it should be an either-or, and I don't think that it should be, certainly when I think of the alternative to state funding going to this, the alternative is presumably privatisation. I don't want to see the option of a publicly assisted dying facility, which is available to all, being withdrawn in favour of a private death industry taking place in Jersey. What would that look like? It sounds very dystopian to me. And although I know people instinctively have a mistrust for government and for the state, I think, you know, if we were looking at it through the other end of the telescope, going back to the question of IVF and birth, would we say that birth is not something that that government should get involved in? Is that something that should simply be provided for privately? I think birth, healthcare in the middle, and end-of-life options are all something that intrinsically do bring into the orbit, fall in the orbit of the state. And I don't think we should shy away from that, sir.
Thank you, Deputy. Deputy Coles.
Thank you, sir. I just want to talk on this one because it's a shame. The line in this amendment is about respite care, sir, but we've heard a lot about assisted dying and palliative care. But respite care is something different. It is that break that is provided to carers who are looking after people with needs. And so the other issue with this amendment is that it's putting the money back into HCJ. But as we've heard from the Social Security Minister, that the money that funds respite care actually comes from the Long-Term Care Fund. So I'm not going to dwell too much on this next point, Sarah, but there is another amendment, Amendment number 5 to this budget would actually see the allocation for the Long-Term Care Fund increased by nearly £11 million a year. Just going to leave that there because it's my own amendment, sir. So for me, the important part is this. For me, it's moving money in the wrong places in the wrong direction. I'm not going to comment on the tone or the terms around how this debate seems to have gone, but actually more the fundamental mechanics of it, sir. That this is diverting funds, which is a growth bid from the health service back to the health service, but just in another place, sir. So for me, sir, the mechanics of this amendment doesn't work, and that's why I won't be supporting it.
Thank you, Deputy. The Minister of Health and Social Services.
Thank you, sir. Before I start, I'd just like to thank all the previous speakers, because I think they've all raised some very interesting points and given a lot of useful
clarifications, sir. Sir, as Deputy Wilson has explained, this amendment proposes the reallocation of the funding already set aside for the establishment of the Jersey Assisted Dying Service to palliative care, respite provision and support for carers. Regardless of whether we need another increase in funding for palliative care, I suspect that most members, possibly even those opposed to assisted dying, can see that in real terms, this amendment is little short of a wrecking motion that flies in the face of several decisions taken by this Assembly. In November 2021, through P95 2021, the Assembly agreed in principle that assisted dying should be permitted in Jersey, and importantly, that the service should be free at the point of access. In May 24, through P18 2024, this Assembly reaffirmed that position and agreed that funding for the assisted dying service would need to be provided in a future government plan, not involving health budgets. This amendment seeks very clearly to overturn that position and the principle of free at the point of access. In addition, the suggestion of a user pays model is deeply problematic. If the Deputy's amendment were to be adopted, sir, and we didn't then resort to funding the service by drawing on the existing health budget, it's almost certain that an alternative user pays policy would create complete inequality of access. As mentioned, it's already been agreed that islanders who wish to have an assisted death should be able to do so here in Jersey under a law with stringent safeguards free at the point of access. That principle of choice and safety was at the heart of all of our previous decisions. Furthermore, and whilst it's not the most destructive element, this amendment lacks clarity and evidence. There's no needs analysis and no assessment of existing provision. It doesn't specify what type of respite care or additional support is required for carers, nor does it state how the money would be distributed. Meanwhile, let us remember that this Assembly has already agreed an additional £3 million a year for palliative care and end-of-life care through the 2023 government plan. And that was only decided as a direct consequence of the anticipated introduction of assisted dying. That investment is already improving services quite dramatically, as evidenced in the addendum to P65 2025. Finally, the funding for assisted dying is currently held in reserves, not within the health service operational budget. It's based on the upper end of best estimates, and the intention is that it will be recast once the service begins and actual costs are understood. In my view, sir, this is a prudent approach for a new service, and it avoids destabilising other areas of healthcare. So this amendment would simply derail the agreed assisted dying programme, create uncertainty, risk undermining equality of access, and reverse decisions that were made after extensive consultation. Indeed, it runs completely contrary to the conclusions of the ethical review that Deputy Wilson herself commissioned. Sadly, this amendment seems less about improving care and more about frustrating the public's right to have choice at the end of life. So with all of those facts in evidence, I'm more than happy to leave the matter to the good judgment of my fellow members. Thank you, sir.
Thank you, Minister. Deputy Balash.
So that was an interesting speech from Deputy Tadier. But I'm sure that even he would acknowledge that every policy adopted by this Assembly has a cost. And the basic point being made by Deputy Wilson, as I understand it, is that the cost which is attributed to the policy of assisted dying is disproportionate to the number of people who will be likely to take advantage of it. I've tried unsuccessfully so far to obtain accurate figures of what the cost of the assisted dying policy is going to be, because I don't believe that the figures in this amendment are an accurate assessment of what assisted dying is actually going to cost the island. I think it will be significantly more, particularly if the recommendations of the scrutiny panel on which I sit as to training and other peripheral changes are ultimately adopted by the Assembly. The expert advisors appointed by the scrutiny panel pointed us towards a report which was made by the United Kingdom government in relation to the estimated number of people who would take advantage of assisted dying if the English law were brought into force. And I took that estimated number, divided it by the population of England and Wales, and multiplied it by the population of Jersey. And the result of that was that a figure of less than one person in year one would be likely to take advantage of assisted dying. After 10 years, it was a figure of 7. Now, those figures are English figures, and perhaps there will be a greater enthusiasm in Jersey for the adoption of the assisted dying policy. But I think there is a case for adopting a different policy if one is to have assisted dying in Jersey from that proposed by the Minister. I'm not going to support this amendment with some hesitation, perhaps, but I'm not going to support it because I accept the argument of the Minister that the states have made an in-principle decision, and it seems to me that we need to debate the law which the Minister has brought forward, which we are going to do at the beginning of next year. I think the adoption of this amendment would upturn the arrangements in the Health Department, and that ought not to be done until decisions have been made in relation to the proposed law.
Thank you, Deputy. Deputy Miles.
Thank you, sir. I want to speak to explain my position on this because it's not straightforward, and I am at this stage in a bit of a quandary and undecided as how I'm going to vote on the amendment. I recognise the arguments that have been put forward, and I feel that I want to support it. But I also believe that the issues it raises are complex, they're difficult, and I intend to listen carefully to the full debate before reaching a final decision. I don't share Deputy Binay's view that this is a wrecking amendment. I think this amendment challenges the significant allocation set out in the budget for establishing an assisted dying service. It's undeniable that this represents a major commitment of public funds at a time when we all know that the health budget is already under extraordinary strain. We've got multi-million-pound increases across acute services, mental health, primary care and community support, and I think it's quite reasonable to question whether this new investment could be more effectively deployed towards established pressing needs. I'm grateful to Deputy Wilson for raising these issues. I think it offers a very different perspective. We all know that palliative care, while showing improvement outlined by Deputy Barbara Ward, remains only partially developed, and the government itself has stated that assisted dying shouldn't be delivered until palliative care reaches a defined standard. This amendment can be seen as a mechanism for ensuring that promise is kept in practice. Likewise, comments have been made to review and improve support for carers, and the Social Security Minister has articulated how she's working on those. And I'm particularly grateful to the Minister for engaging with me on a number of issues around this. Again, this amendment seeks to address that gap proactively, rather than waiting for another cycle of deferred action. So the text of this amendment highlights a key point, the idea that an assisted dying service can be delivered free of charge, and it suggests that's not accurate. And it certainly wasn't something that I'd really considered before reading this amendment. Under the current proposals, the taxpayer would fund the full cost of implementing and operating the service, inevitably at the expense of other health priorities, notwithstanding the previous in principle debate. I think we've got to be really honest about that trade-off. There may well be more cost-effective models, and it isn't unreasonable to explore them before committing millions of pounds to a service that will be used by relatively few people each year. And for that reason, I'll be really interested to read the report of the Assisted Dying Panel and actually to see whether they do bring an amendment to that effect. So the amendment argues that spending substantial sums on a small number of individuals seeking assisted dying while underfunding services that support thousands who want to live well may not be an optimal use of public money. And I do tend to agree with that. It suggests redirecting funding to areas of immediate need, respite provision, palliative care, carer support, and strengthening the structures that will improve the quality of life for the many. And I'm very sympathetic to that. The Deputy has made it quite clear that she doesn't think that this amendment reopens the debate on assisted dying itself. It does recognise that members may support the principle while disagreeing that the service must at this stage be funded through the public purse. I think what it does do is allow the Assembly additional time to consider alternative procurement models and better understand the true financial implications before proceeding. And I sincerely hope that the Assembly will be assisted in that regard by the report forthcoming from the Assisted Dying Scrutiny Panel. So members will know that I fully support the principle of assisted dying. I believe that under the right safeguards, it represents a compassionate and humane option for people facing unbearable and irreversible suffering. But supporting that principle doesn't mean that I have to accept any funding model at any cost without proper scrutiny. And at the same time, I recognise that palliative care and support for carers are critical components of our health ecosystem. And this amendment raises legitimate concerns about how these areas are being sufficiently prioritised. These are considerations that affect me personally and weigh on me heavily. I've spoken in this Assembly before about the lack of support for carers and insufficient short break service, particularly for children. So yes, I want to support the amendment. I see the logic and I see the compassion behind it. But I also want to do justice to the seriousness of both issues, the need for high quality end-of-life care and the need for a carefully designed, responsibly funded assisted dying framework. So for that reason, sir, I'm still on the fence. I will listen closely to the debate and make my decision in due course. Thank you, sir.
Thank you, Deputy. Comment Robertson Clement.
Thank you, sir. This amendment, sir, I think is probably the most emotive and probably the most worthy of the amendments in the debate about the government plan and budget. I'm not sure where I stand because it may well be that given the information from the Health Minister and the Social Security Minister, it may well be that they have these angles covered. But what I can say from experience is that in our parish we have many families of carers with young individuals who are looking after whole families, many with complex physical and mental problems, and some at their wits' end. We managed to help an individual lady with respite care recently and gave her 5 weeks respite. And this was an individual who had problems with a utility company and also was and is suffering from cancer. And the change in her attitude and apparent wellness after that respite care was magical. I do think that is something that we need to do more about. I do wonder whether the Deputy might want to split items 1 and 2 and whether that is possible, because it seems to me there is a big difference, if I read the room right, between the assisted dying segment and the respite care. But I will leave that to the Deputy. But for the moment, I'm a little bit unsure which way I will go on this, and I'll leave it at that. So thank you.
Thank you, Deputy Moore.
Thank you, sir. This week is all about difficult choices for difficult times. And I commend the Deputy for offering us this thoughtful way forward. Many fine speeches have gone before, so I will shorten what I was going to say. But I thought it was important to remind ourselves of the work of another thoughtful woman who did careful research, and that is the late Dr. Margaret Bayes, who for many, many years fought for carers. And in 2022, she brought an action plan that, as part of its Year 3 actions, included genuine respite options and a pool of carers. Dr. Bayes would not have put that in her action plan had she been satisfied with the access to respite care that was being provided in the island for carers. And I really would like members to reflect very carefully on that wish of that really impressive woman who had worked tirelessly for many, many years. And I certainly have no problem with supporting this amendment. I think it offers us a sensible solution, but I would also agree with the Constable of St Clement that offering a choice between supporting either or both of the options that are being provided by the Deputy may be helpful to some members.
Thank you, Deputy. Deputy Joan.
Thank you, sir. And I wasn't planning on speaking and listening. Like Deputy Miles, I'm not yet there with where I'd like to go, but I just wanted to and I thank the proposer for bringing these important issues. But I'd just like, maybe I'm looking at not necessarily the report and the discussions we're having, which are very weighty topics around assisted dying, respite care and palliative care. But if we look specifically at the amendment before us, I just would like to ask the proposer in her summing up to understand that the amendments that we have here to vote on is to take head of expenditure for the central reserves, which has specifically been put aside for assisted dying, to be put to the health and care Jersey budget to fund respite care. But I think we heard from the Social Security Minister that actually it's the Social Security budget where respite care is, whereas palliative care would be, of course, under the health and care Jersey. And why, even though she mentions palliative care in the report, this money will not support palliative care because it says respite care, and I'm a bit confused about what that means, because for me, as part of when I have been, and I've spoken up in the different debates we've had on assisted dying, one of my key principles is that palliative care is funded correctly and strongly before that I will then support assisted dying with that balance in place, and the Minister knows that. We've talked about it individually before on that. So I think it's important to talk about palliative care, but the amendment itself, when we look at the actual amendment, it's going to respite care. So if we agree to that, it would have to go to respite care, and it's not the right budget line that it would be going to. I'm just trying to understand how that will work and whether technically it would work, and maybe the Treasury Minister could also say, if this passed, how would that work? Because we would have a money going to the health budget that doesn't actually implement respite care. Thank you.
Thank you, Deputy. Does anyone else wish to speak on the Deputy Catherine Curtis, then Deputy Sutton? Yes.
Thank you, sir. I'm only speaking to say that as Vice Chair of the Assisted Dying Panel, we are still working through our review. While I support any moves to make respite care or palliative care more accessible, this amendment is to take funding that's allocated for the assisted dying service. The panel is currently working on our review and any potential amendments. And so the timing of this amendment is all wrong. Therefore, I will have to abstain.
Thank you, Deputy. Deputy Sutherland.
Thank you, sir. And I've been around this assembly for a number of years now, and increasingly I find that whenever issues come up, especially sensitive issues, I've debated them before in some form or other. And what I heard today was the proposer say there is no EU right to die. And then left off the second half of the sentence, which was without additional safeguarding. And for this proposer to say that we are not re-debating the right to die issue, that's done and dusted. And then go on to mention and talk about conditions around the right to die is dangerously close to accidentally misleading us. The fact is, there is no right to die in the EU, but what there is safeguarding procedures in every country that slightly differ from one to another, but nonetheless are there to make sure things are done properly. And that debate has been had and now has been rehashed by, and again, I think back to my time, by one of the oldest tricks you can pull in this chamber, which is after 3 months you're not supposed to, you have to give 3 months before you can re-debate the same issue. The easiest way to include a re-debate of a proposal is to, let's go to the money. And let's talk about the money, because that's always a good one. We can do what we like with how do we fund this, and it often rings bells with many members in the States, and I've seen it today and the last 2 days, where money has been the issue which has led to reviving debating the issue itself rather than the conditions, the safeguarding that's around it. So I can't bring myself to support this amendment.
Thank you, Deputy. Does anyone else wish to speak on this amendment? I ask Deputy Wilson to reply. Deputy Wilson.
Thank you, sir. And if I could first express my thanks to those who have contributed to this. As a carer, having access to respite care is not an optional luxury. It's a lifeline that allows carers to continue their work safely and sustainably. And without it, they burn out, they jeopardise their own health and well-being. And the impact is that we see hospital admissions increasing and families and patients facing avoidable suffering. We've heard a lot of perspectives this morning, and really that was what I wanted to do, which was to explore the idea of whether or not the Assembly understands the importance of respite care in the context of improvement to palliative care services and in the context of the forthcoming debate on assisted dying. And it's very interesting to hear Deputy Southern comment about my intention around one of the so-called oldest tricks. I just wish perhaps maybe I had the political guile that he has to use that as a method upon which to present my arguments. Deputy Moore mentioned Dr. Margaret Bayes, and I had the pleasure to work with Dr. Margaret Bayes and saw firsthand just how committed she was to trying to improve the lives of those who care for vulnerable people. For years and years and years, she campaigned to get simple commitments, simple ideas into the political arena that she hoped would actually build a bit of traction and raise the profile of the needs of carers. And in one sense, sir, it was her work that really caused me to consider what have we done about carers? What have we done about carers legislation? And what have we done about respite support, given the work that she had done to bring this into the public domain before? And when I saw the sum of £2.7 million, I thought how easy it is to actually just allocate a money to a policy that, yes, we all have agreed upon. But how come we don't apply the same principles to things that make a difference to people's lives in other ways? We've heard from Deputy Dublé and Deputy Catherine Curtis about the work that's going on in the assisted dying panel. And I really look forward to seeing what the outputs of that are. The problem is that we are faced with a decision today about the budget, about what we do with £2.7 million that's been identified for something that we have not yet had a debate on, to close the loop on how and in what way we move forward. And so this was merely an opportunity to say, is it the right time to commit ourselves to spending that money now, when we know that there are other needs around that could actually be satisfied very well by the investment in the care of carers and providing respite care. Deputy Binet mentions that there's no needs analysis, and I agree with him. We've got very poor data on the number of carers and who should be eligible. I think the only data that we've got is the Social Security data. So I think that's an issue, because we don't really understand how much money we need to support carers and respite care. But what we do know is that if we redirected that money, we could provide, based on the numbers that are claiming home care allowance, that we could offer almost 77,000 hours of home care, which is paid at a rate of £34.80 a week, which would allow people an opportunity to go and do something different as a carer away from their caring responsibilities. We could offer 2,150 hours of residential respite care, which means that relatives could be assured that their relatives will be looked after in a residential facility, while they themselves looked after their own health and well-being. The sums of money that we're talking about are equivalent to 40 to 50 full-time carers, and how many times have we heard that we do not have enough people to deliver our health care? I'd like to particularly point out the I'd like to acknowledge the comments made by Deputy Miles. And what really is comforting by her response to this is that I think she gets what I was trying to do. I was trying to actually say, could we just think about this? Could we just take stock, and rather than gallop away and rush into allocating a sum of money in a particular way, could we just take the foot off the gas, do the necessary preparation, and in the meantime fund support for those where we know that need is obvious and immediate. And I believe, sir, that this was, despite the criticisms of cynical views being that I'm trying to deliver one of the oldest tricks, what I was trying to do was to introduce some elements of compassion into the debate about how we use money. Conatop Troy talked about the prevalence of carer support in our parish, and I'm very privileged to work with him and fellow deputies and have witnessed the amount of effort and energy and organisation that goes into freely providing support for people who need assistance, all done on a voluntary basis. Wouldn't it be nice for us to be able to say, we recognise that? Here's some money, we'll work with you. You come up with some ideas to give us an idea about how you could add quality to that, how you could add value further to what you're doing to support people. Deputy Jean talked about the difference between palliative care and respite care, and I acknowledge, I think she's right to separate these two things out. The respite care is different because it is care that is needed when people are looking for their loved ones constantly on a 24-hour basis. And when we hear people say, you know, I could just do with a day off, or I could just do with a break to relieve myself of the care and responsibilities, that's what we mean by respite. Palliative care is clearly very well defined, and I don't particularly want to revisit the definitions of here. But for me, funding respite care is an important part of how we prepare those people who are otherwise engaged in looking after vulnerable people who may well also need at some point palliative care themselves. The final thing I just want to comment on is Deputy Balash's reference to the figures which are not available to tell us just exactly how much assisted dying is going to cost. One of the things that we do know is that, and based on some estimates, is that respite care is an investment that will probably cost the island between £2 and £4 million based on the number of people that need it. The fact that they provide that unpaid care saves the health service millions of pounds. And when I've looked at some of the estimates, some of that goes into 16, 17 million pounds saving for the health service. So as far as I'm concerned, sir, making a decision about how you shift the way in which money is allocated around the care sector can be quantified in some areas, but I acknowledge that going forward, the figures around the assisted dying costs cannot be identified. Deputy Coles talked about money being used in different places and the mechanics for it. I think what we've got to be mindful of is that behind any proposal for assisted dying or any proposal for respite care, there are people involved. And there is an old principle that money should follow people and not the other way around. And what I'm trying to establish here through this amendment is to say, we've already decided that there needs to be money for an assisted dying service, and that is going to be under the remit of the Assisted Dying Review Panel as to how they assess and analyse the funding. But what we haven't done is we haven't committed anything other than through the social security funds to how we will actually support respite care. And this is one of the things that I was trying to suggest that we could do in the interim. Deputy Ward talked about, Deputy Barbara Ward talked about the fact that she couldn't actually make a decision because of the scrutiny process. I think Deputy Dublé does not, Deputy Dublé wants to complete the work on the assisted dying principle, and the reason why she's abstaining is because I think it puts her position around her decision making in a difficult place, and so I respect that. But I would urge people to think about the principle of why we are, or I am proposing this, which is not to wait for a scrutiny report, but to actually decide, is it feasible and is it an option that we've got available to us to consider moving some of this money into need and care that is needed now. So I think that's all I want to say on that. I think the cost of, if carers stop caring, I do think that we would be averaging around an additional £15.5 million burden on the health service. And I just ask members to think about that and to consider whether or not this amendment, if we did make a choice to move some of this money, would actually alleviate some of the cost burden on the health service in meeting some of the needs that they clearly won't be able to address if their support is not supported and they do not receive the necessary recognition for the work that they do. And I call for the appel, sir.
Thank you, Deputy. The appel has been called for. Members are invited to return to their seats. Ask the greffier, Deputy Wilson.
Thank you, sir. Sorry, Deputy Conatop Troy has just reminded me about whether I would consider taking this amendment in two parts.
It's your decision, yes.
And I am happy to do that, sir, because what I do want to make sure is that we can secure some money for respite care if members would allow me to do that.
Yes. All right, so we're taking the amendment in two parts. Part 1 and part 2. Yes.
Sorry, sir, if I may ask for a point of procedure, order. How can I just ask how that is possible, given one is money, the other is a head of expenditure? Just curious. I could be wrong, obviously. Thank you.
I see what you mean. Nonetheless, I think on balance they can be voted on separately. They both deal with the funding for respite care, which we know from the report incorporates palliative care as well. The first paragraph deals with the spending for next year only, and the second part deals with the next year and 2027, 28 and 29. But on balance, in my view, they can be voted upon separately. But thank you for raising it, because there's validity in what you say. So the Deputy Gorse.
Whilst I absolutely agree with your ruling, sir, that my reading is that if one separates the votes, it's quite difficult to separate the allocation either to or from assisted dying from respite care in the way that the Constable of St Clement seemed to indicate a separate vote might do. They simply are either 1 year or future years, not the separation out of the allocation or use of the resource.
Yes, that's correct as well. So we're now voting on part 1 of the proposition, and I ask the greffier to open the voting. All members have the opportunity of casting their votes. I ask the greffier to close the voting. Part 1 has been rejected, 9 votes for, 31 votes contra, and 3 abstentions. We now move on to part 2 of the amendment. I ask the greffier to open the voting. All members have the opportunity of casting their votes. I ask the greffier to close the voting. I can announce that part 2 of the proposition has been rejected. 8 votes for, 32 votes contra, and 4 abstentions. We'll now move on to the 27th amendment, lodged by Deputy Gardner. And I ask the greffier to read the amendment.
Page 3, paragraph B8. After the words in Appendix 2, Summary Tables 5.1 and 2 of the report, insert the words, except that in Table 5.1, the head of expenditure for the Central Reserve should be decreased by 137,000 to be allocated from the growth bid funding for investment in competitiveness. And the head of expenditure for education and lifelong learning should be increased by 137,000 to be allocated to the funding line for nursery 2 to 3-year-olds. Page 3, paragraph B7, after the words are set in the appendix to the accompanying report, insert the words, except that on page 42 in table 9, 3, the head of expenditure for central reserves shall be decreased by 137,000 in each of 2026, 2027, 2028 and 2029, with funding allocated from the growth allocation for investment in competitiveness. And 4, the revenue head of expenditure for education and lifelong learning should be increased by 137,000 for each of 26, 27, 28 and 29 to be allocated to the funding line for nursery 2 to 3-year-olds, with any consequential amendments to be reflected as necessary throughout the budget.
Deputy Gardner.
Thank you, sir. There is one thing that I agree with the comments from the Council of Ministers, that the Assembly is rarely the best place to negotiate detailed technical issues. And that is precisely why this amendment was lodged at the last minute, just before the deadline, because I did hope that the Minister and the Council of Ministers would sit with the providers. I circulated this morning, as I know that it's really technical, page A4 and the presentation to the members with the numbers to consider. I do support the policy, and interesting that comments paper saying it's disappointing that this amendment has overshadowed a positive policy which will be of significant financial benefit to families at a time when they're telling us what they need. I completely support it. I completely support the policy. It's nothing to do with the policy. I would say it's disappointing that the Education and Lifelong Learning Minister didn't meet for a year, from November 24, with providers himself, with providers who will deliver this important policy. Until last Wednesday, we all believed that the policy will be delivered through the existing established process that already works for NEF funding, direct transfer to the providers. But at the scrutiny hearing, not last Wednesday, it was a Wednesday of the 2 weeks ago scrutiny hearing, the Minister unexpectedly announced a shift for paying to parents directly, as he didn't reach an agreement with providers. That it was a moment when it was clear we are heading to unnecessary and problematic bureaucracy, just because the numbers simply were not matching up. The £11 rate is not viable. Because I didn't think this is the place for the debate, on Thursday morning I called the Minister. We did have a conversation. And I've heard from the Minister why any amendment should be lodged because it will disrupt the policy. But the only thing that I asked the Minister on that Thursday, please sit with the providers. They're meeting your officers, meet with them, and look at the numbers together. And I hope you can find a way forward. And from that Thursday to Monday, which was the deadline for lodging an amendment, I genuinely hoped that engagement would happen, but it didn't. Instead, we have a proposal that bypasses the sector delivery that over 75% and creates a complexity where none is needed. So let's deal with evidence. £11 is not viable even using the government-owned figures. You have numbers and presentation in front of you. It's on the second page of the presentation. that it's this page. And this was independently gathered by the economy department that was presented to the providers. And if you look the column, how much does it cost to provide 2 to 3, you can see the numbers. What was agreed, the 1024, in that particular presentation, it's the net, but it doesn't include cross-subsidy and it doesn't include profit. Since that modeling was completed, the sector had 2 minimum wage increases and another one will happen in April 26. We know that electricity insurance, food, parish rates, water have also increased over the last year. Under government assumption, £11 leaves 7.6% top up for profit and cross-subsidy. Cross-subsidy, what is cross-subsidy? 0 to 2, they are much more expensive. They need at least 4%. And if we don't want parents who children 0 to 2 attending and their prices will rise further, we need to have this cross-subsidy. This is how sector work all the time. It means it's leaving around 3.6% to cover reinvestment, wage increases and profit. No regulated early years provider can operate on 3.6% margins. It's not a Jersey Early Years Association being difficult. This is arithmetic accurately refusing accept terms that could destroy financial viability of the provider's care. Another point, and it's a valid point, that not all nurseries has 0 to 2 provision, but it misses point that 16 nurseries do have 0 to 2 provision, and it's more expensive. What will be the consequences if we underfund 2 to 3 and cross-subsidy will collapse? How would you tell to the parents that actually 0 to 2 will be cost more? The minister keeps saying some nursery charge fees less than £11. It's absolutely true. But what minister doesn't tell in the comments, and what is crucial, you can charge under £11 when you have full-time attendance. When you look at the nursery fees and they have only 15 hours of attendance, the fee is going higher because to employ part-time, it's less sustainable and it costs more. And hourly rate is higher. So all nurseries on the island know this, and hourly rate for 15 hours is always higher than the hourly rate for full-time. Government paper says 11 is reasonable. If nurseries would think it's viable, they will sign. They have not. And it's not because of the politics. It's because the maths do not work. Now, second thing to consider, and the government repeats offer will deliver significant financial benefit to family, and I agree. The family can actually access it, but family cannot access places if provided cannot afford to deliver these places. So this amendment, it's not about delivery, it's not about the theory. We can put 15 hours in budget document and we can write in headlines, but if nurseries cannot afford to operate on this fee, the offer collapses. Another argument, paying parents directly give choice. Might be, but does give cash flow risks. What's important to understand, and it's public who is listening, if this amendment is not successful, the families who planned from 1st of January to use £660, it's approximately 15 hours of the nursery by £11, they will need to pay upfront and have to go through the new government bureaucracy that would be created to get a refund. I know that Minister in the comments put, oh, we will support the families who cannot pay upfront. How this will be assessed? Is it again only income support families? Would the families who don't receive income support have mortgage and actually already plan on this £660, need to find out to pay it and after somehow to get a refund? We already know that after school provision, parents been paid directly, and we know there are some after-school providers that still trying to recover the debt. So to pay upfront can create other problems. Direct payment to nursery reduce admin. a reduced admin for nurseries? Absolutely. But it will increase admin to the government. Verification checks, attendance reconciliation, tax coordination, income support integration, arrears management, and also support who can pay upfront. This payment will have manpower implication. Think about it, it's ASH, Employment, Social Security and Housing Department needs to be involved, Education Department needs to be involved, and Treasury Department need to be involved, and possible charities and parishes, as Minister suggested in his response to oral question last sitting, can support the families who cannot pay up front. This is very bureaucracy that we told the government wants to avoid, and it will cost more, maybe less, but it will create unnecessary bureaucracy instead of supporting the businesses. And sector did accept the model. They rejected the rate because the rate is not viable. And instead of engaging with them, it was easy just to say they will need to get on and we'll find a new system. This amendment provides the simplest, cleanest solution. 50p uplift for an hour, costing 137,000, avoids new bureaucracy, new admin structure, parental upfront payment burden, provider risk, hybrid rollout that will cost more to administrate, and destabilization of the early workforce. The real question before members, do we invest 137,000, tiny adjustment to 1.35 billion budget to ensure the childcare access placement promise, parent aren't forced to pay upfront and reclaim, nursery can operate sustainable, and the early years policy does not fail on day one. Or we build a reclaim system that costs some more, less, and harder to administrate, and risks excluding the very families we are trying to support. And I'm looking forward for members' comments and questions. Thank you.
Thank you, Deputy. Is the amendment seconded? Thank you. Minister for Education, Lifelong Learning.
Sir, I wonder if before the Minister starts I could just put on record that I do have a young child who would benefit from any free hours in the coming years. I don't believe, because it's a shared interest with a large number of people, it would prevent me from voting, but I would like it on the record, please.
Thank you very much, Deputy. Yes, Minister.
Thank you, sir. Today to the Deputy, I hope we get through today for you. It's very important. So I expected the narrative that we've had before about not communicating. I was going to leave it, but I would just say one thing. We've had a lot of criticism of civil servants in this Assembly. I would like to praise the civil servants, the staff who have worked on this for 7 months, taken clear direction from myself, and met with the sector up to 30 times now in order to come up with a scheme that could work. And so therefore, sir, I trust those members of staff to do their job. They're paid to do their job. They do their job very well. That's exactly what we should be doing in making decisions with clear direction from myself. And so I haven't received a single request for a meeting. Happy to have a meeting at any time, but it will be exactly the same process. That's an effective use of my timeshare, and I'd call it leadership. But let's be more positive, sir, because this is a really positive project, and this is what we need to look for. So I want to explain why we should oppose Amendment 27 concerning a childcare funding rate for 2 to 3 year olds. The proposed cost of this amendment is £137,000 per annum. However, because we will increase by inflation, that increase would be greater over time. And this is funded from investment in competitiveness. So it takes away from a fund that looks to address those areas of our economy. And while I appreciate, to some extent, the intention behind the proposal, I urge members to consider the facts correctly. I'm not going to go over the point about when I was contacted. I think we'll leave that and let's move forward. Let's be positive. First, sir, some background. Our policy aims remain clear and unchanged, to maintain choice and to increase the availability and accessibility of childcare, to continue improving outcomes for children under 5, to ensure quality across the early years service, and to reduce the cost of childcare for parents. and importantly, to invest in Jersey by creating an early years childcare system that attracts people to work and return to work here. Our intention is simple. Children and families should benefit from this financial assistance in early 2026. I must address the idea that simply accepting this 50p means we can just roll out a NEF system with no bureaucracy is completely incorrect. It will delay the entire system for months, and we still don't have guarantees that will be accepted. I'll come to that later. But where we are now, sir, is we are at a stage where this is a reality. We are about to deliver these hours. So how was that rate calculated? The economics team in the Department of Economy worked independently of SIPES alongside the Jersey Early Years Association to determine the cost of providing childcare for 2 to 3 year olds. After considerable analysis, they agreed a base rate of £10.24 for a specimen nursery. This includes staffing to regulatory requirements, very important, utilities, rent, insurance, and additional rows such as Senko, driver, and chef. Staffing costs were typical of the sector and above the living wage. To allow for inflation and sustainability, the proposed hourly rate was increased to £11 per hour. This rate was index linked to RPI, with the next increase scheduled for September 2026. This is far from setting the lowest rate as was suggested and builds in inflation. While the calculated rate is not felt to be financially viable for some settings, it would significantly reduce the financial burden of childcare costs experienced by families. Parents will be able to access up to £6,270 per child, which will be considerable support for them. This demonstrates that we have listened and are responding to their concerns. So I must talk to members about cross-subsidy and reserves. The amendment refers to cross-subsidies. The cross-subsidy is a fund to fund extra monies for nurseries that take babies. However, 12 out of 28 early years settings do not care for children under 2, so they would not require additional funding for cross-subsidization. It must also be asked whether the money directed for 2 to 3 year olds should be used for this purpose at all. We are funding a 2 to 3 year old offer. That's what this money, this government money, this public money is for. Additionally, sir, not all settings employ drivers and chefs, so it does not make financial sense to increase the hourly rate for settings that do not serve age groups under 2 year olds, nor have drivers or chefs. The amendment also mentions reserves. The £11 rate already includes an element for sustainability. It is neither appropriate nor reasonable for government to allocate future reserves for private businesses. This is public money that we must ensure is used for best possible purposes, sir. In this case, the payment for 2 to 3 nursery hours. And so we do not see the books of nurseries. There is no way that we can access those books. We went through the process with some nurseries to come up with a flat rate. So I think the data that we've been produced today has no firm basis that was circulated by the Deputy. Our research shows that the average hourly price charged across providers is £10.10. 5 of the 7 settings charge up to under £11 for all session types for 2 to 3 year olds, all session types. Therefore, the government's proposed rate, supported by economic analysis, is both reasonable and appropriate. So paying parents, let's talk about the direct payment to parents. Paying parents directly, and so this is in order to get this scheme up and running, has become a much better system the more that we've worked on it, much more flexible. I'll explain why. It increases parental choice, flexibility, and maximises parental benefit, addressing affordability and constraints directly. By paying £11 for 15 hours, those nurseries that do charge less, and there are many, the actual number of hours accessible by parents might be slightly more. It gives them more flexibility. And if nurseries charge slightly above £11, that the parent is paying the extra 50p for 15 hours rather than the £11. That's the simple mathematics that we need to understand. And that direct payment allows parents to do that. It removes also, sir, the term time constraint and any confusion over the 15-hour cap. It allows families to budget and access care year-round should they choose. It is real help in parents' pockets where they need it. It could also allow in the future access for nannies, as suggested by scrutiny panel. And so nannies aren't just for the very, very wealthy. There is a benefit if you have 2 or 3 children, so employing somebody, it makes sense. It can actually be less expensive. So that ability is there. But so we have to get the scheme up and running first. We have to take action. And so, very importantly, it includes childminders for the first time. And the dialogue with them, and I've had exactly the same level of direct dialogue with childminders, and they've had exactly the same level of dialogue with officers, but don't seem to have an issue with that, but see the benefit of this system, which is I welcome. So it simplifies implementation. For example, it can be uprated annually rather than subject to sector negotiations, or, as we're doing today, setting the rate on the floor of this assembly repeatedly, because somebody wants to bring that to the assembly. And so paying parents directly does remove the administrative burden for settings. Currently for the NEF, settings have to look at passports, they have to look at utility bills, they have to go through checking processes. And I've been told directly when I visited settings that the work being required of them was underestimated and that calculations can be onerous and time-consuming. With this process, providers simply do what they are doing now. They provide the hours and give a receipt to the parent. That is the sum total of the work that the sector has to do. It allows also the Childcare and Early Years Service, KEYS, to focus on promoting high quality in practice and adhere to regulations. That is the job that they have. That is what those civil servants are employed to do and do so well. This frees them up to do that. And so I recognise about parents who can't afford to pay up front. I will say there's up to, I don't know what the latest figure is, around between 85 and 90%, I believe, of nursery places are already allocated. Parents are already paying. So for a large chunk of parents, they understand that. And I have spoken to quite a few parents, some who have been quite pushy and said, please, can we get this working? And I said, yes, we're doing our best. They're quite happy, okay, to have something in 2022 that gives them the entire payment. If it's not up front, that's not the end of the world. They know it's coming and they can budget. When you have children, sir, and I'm sure you know this, you budget for that. And this can be managed. But I do recognise that some parents need financial support. So this is already happening. We have got really good relationships with groups that help parents. The Jersey Childcare Trust, just one example. There are others. I've been incredibly positive about the way that they could support this and help with this. And I will ensure, sir, that there is a simple process to help these parents. My team are actively discussing options and processes with the partner organisations to make this happen. I also know, sir, from conversations with constables already do this, parishes already do this. They help parents out when they're struggling. And they can support those, and this is the first opportunity, they'll get an opportunity to get that money back, which I think is a really positive move forward. And one of the benefits of piloting direct parents to parents is that we can be fleet of foot in testing and learning different ways to offer support. So I see this currently as a year's pilot programme. I personally think it's always best, sir, to do a 2-year pilot so you can iron things out as you go. But as we've done with all of the pilots, perhaps 3 years, sir, depending on what certain people need for their children. So I'm getting that little look across, I completely understand that. Sir, but I think we can work on ways to offer support. And I urge members to be really careful in the narrative around this. Headlines and comments that scaremonger do not help parents that we want to support, we want to identify. I know, sir, there are unregistered settings that offer childcare of a standard that we do not want. When we find these, we close them. To parents in these settings, I will say, please come and speak to us. We want high quality care, and you can now access 15 hours. There are ways for a smaller number of parents that we can support. It already happens. This will formalise that and it will make it happen simpler. So there was a parental survey carried out by ISOS and the results of 1,250 responses in October 2025. 95% of parents surveyed feel the affordability of childcare in Jersey is very poor or poor. This can lead to difficult choices as to whether they make economic sense to go out to work and pay for childcare or stay at home and provide childcare. This has never been more important that we start this process now and to constantly re-enter negotiations with a few members of the sector is not going to get this in place. So there are lots of other details. I won't go through them all because I know people want me to get on with this. But so I do need to explain this carefully. And it was the ISOS Roundtable report. The development benefits of high quality early education and care for children aged 2 to 3 are well attested in the international evidence base and are particularly critical for those children from disadvantaged backgrounds. So what we have done in the last 18 months is entirely in line with our CSP commitments. We have delivered an extension of nursery and childcare provision to children aged 2 to 3 with additional needs. We have delivered successful pilots to access unused places in our primary school nurseries. We have delivered a review of the availability of spaces in St Helier. And we've delivered phase 1 of the sector to improve recruitment, retention, training and development. And sir, we can deliver a scheme that is within a hair's width of a universal offer to 2 to 3 year olds. So in summary, while the proposal will suggest a modest uplift may satisfy some providers in the short term, it prolongs debate and distracts from the real goal, ensuring access to high quality provision for children. And it is concerning, sir, that the Deputy suggests £12.8 as the true cost, but proposes £11.50 as a compromise. Where will we actually end up in these very, very public negotiations? I do not believe it is appropriate for fees charged by private businesses to be decided on the floor of this Assembly. This policy is about delivering for children and families. Let us focus on the positive difference this will make. I urge members to allow me, supported by the Council of Ministers, to proceed with direct parental payments so families can benefit from this much needed support as soon as possible, so they can get a full year's benefit of the system I am proposing. And sir, I urge members to let me get on with my job. Please reject this amendment, sir, so we can move forward. Thank you.
Thank you, Minister. Deputy Jan.
Thank you, sir. I'm getting a little bit confused by the tone that the Minister has just set. And I just want to understand if we're not getting ourselves in a twist, if I'm allowed to say that. I was going to say something else, but I thought that was parliamentary. So, because I'm keen on supporting as much support as possible to parents with children, especially young children, to also support parents to get back to work and to be able to have affordable childcare. It's in my manifesto. I'm absolutely for this, and I'm not understanding why the Minister's talked about scaremongering, because Deputy Garner is trying to get more money to parents. So where I'm to help pay for childcare. But as the Minister has just said, there are huge differences between nurseries because there's a mixture of non-profits, public, private. Also, we're saying there's an expansion to childminders. So also, as Deputy Garner said, cost to those in businesses, whether it's an individual, whether it's in a place, is going to be very different depending on whether they are community-based, they sit in and they don't have to pay rent, or they're in somebody's home, versus having to have a specialised building. So all these costs are different. And so what we're hearing from some nurseries is that they are saying that their costs, £11 an hour, would not be sustainable for their business. But shouldn't we think about it in another way? Maybe we shouldn't be saying it should be, as parents are getting, now the Minister said it's up to the parents are getting the money, not the nurseries. So shouldn't we be saying it's more should be a lump sum to support parents to get funding, instead of saying it's 15 hours a week or £11 an hour? I think this is where we're getting stuck on, because if we're saying it's £11 an hour, but we're saying to different businesses £11 an hour is different. Sometimes £11 an hour will cover a childminder, or it would cover the costs of providing support to a child, and in other cases it won't. And that is what business is about. It's market forces, it's what happens. And if the government is wanting to support parents and help with childcare, should that not, instead of maybe putting aside, very specifically focusing on £11 an hour for 15 hours a week, we say there's a lump sum. The Minister talked about, I don't have the figures in front of me, 6,000 something a year. Should that not be what we're talking about here? And we then decide whether we want a little bit more for the parents that Deputy Gardner maybe is putting forward. so an increase like that. And so we can get away from trying to dictate to private businesses how much that they can charge per hour for a child. Because £11 an hour, that's what we're trying to say. And I think that's what's the issue, is some businesses are saying £11 an hour is unsustainable for them. And potentially the Minister is saying there are other businesses that are saying that £11 an hour is chargeable. So why are we confusing and conflating all these issues and just say that actually at the end of the day, what we're wanting to support here, or I'm wanting to support, is a certain amount of money per year is helping top up parents to be able to afford childcare, and it's up to the parents to decide where they send their child to nursery, and they could then shop around and see, and of course it depends on spaces, but isn't that the market as well, to see where they can then, with that amount of money, plus of course the extra. I think the Minister also mentioned that, you know, it's up to the parents to top up the rest. They could then go to different nurseries, and then that money could be 12 hours a week could cover that, because maybe that nursery is providing more facilities, etc. So therefore that cost is different. Or you could go to another one and it could actually be providing 18 hours a week. And so that's where I'm a bit confused where this whole discussion is happening, because ultimately at the end of the day, if we're wanting to support parents, we should just give them a lump sum that the Minister has put forward, or we're now with Deputy Garner, and I'd like to understand if that, you know, with her increased proposal, that would then go to the parents, so then that's an increase. So, and then, you know, because I don't really understand the situation, and then there's an increase to the parents, and then it's for the parents to decide how they can stretch that amount. So maybe we should move away from saying £11 an hour, because it, as we've heard from nurseries, it's not the right true amount compared to. Thank you.
Well, Minister, if you were Minister, if you want to, if you accept, you're allowed, with the consent of the last speaker, to explain something that you've said. If you want to stand up and do that, yes, you can do that.
Yeah, thank you, sir. The 15 hours is to pin on the number of hours of nursery care. From all of the research and all of the work that's gone before, the suggestion is for 2 to 3 year olds, the maximum, the best number of hours is 15 hours in nursery. When you do that, sir, you have to have a rate per hour, otherwise you end up with 15, 20 different rates. So we have an average rate, which I think is a very fair and healthy one. So that's where that figure comes from. What the Deputy is talking about as a lump sum is a different model of doing this. Might be something that happens in the future, absolutely. But the 15 hours, that's where that figure comes from. By paying parents directly, we obviously take the average. For most of them, it will be 15 hours because the difference is minimal, so it might be, you know, an extra 20 minutes, so to speak. But for others, if it's work more than that, the 15 hours have to be topped up with a small amount of money. That's the way that system was work, and that's why, so you get flexibility. So I hope that explains where the 15 hours comes from. If we had an F system, you'd be paying directly for 15 hours, but unfortunately, it seems that some nurseries don't want to buy into that at the moment, sir. If we were to re-establish that now, it would take months, and we would not be able to start this process. I think, so it's a very good trial to start paying parents directly, because it gives the opportunity that the Deputy is talking about into the future. I hope that helps.
So I wonder...
Yes, well, you can ask a point of clarification of the last speaker, but not the Minister. We're not sort of opening question time. Yes, thank you, Deputy Joan. Deputy Catherine Curtis.
Thank you, sir. I speak as the chair of the Children Education and Home Affairs Scrutiny Panel. The extra funded childcare hours should be a good news story. For instance, the Office of the Children's Commissioner told the panel that they view this as a welcome measure that has potential to make a real difference for young children and their families in Jersey. The Jersey Childcare Trust has also welcomed the proposal. As a panel, we have brought recommendations on expanding early childcare support, including a successful amendment to the government plan in 2023. So the panel was really pleased to see that there will be universal funded childcare in place for 2-year-olds. So there is a lot of support for this provision. However, the panel is disappointed that there is still no agreement with the Jersey Early Years Association. During the last year, the panel has had several meetings with JEA and the Childminders Association. We've visited private nurseries and the pilot provisions. We found the standard of childcare in the island to be very high quality. Jersey has more expensive childcare. It also has better quality childcare. We are concerned that any cost pressures placed on nurseries should not result in lower standards. We see this in the UK with tragedies resulting from poorly managed nurseries and unsupervised staff. For example, 9-month-old baby Genevieve, who died from asphyxiation while left unattended. There have been more than 20,000 reports of serious childcare incidents in England's nurseries in the past 5 years. I'm not suggesting that this might happen here, but I am confirming that the safety and quality of nursery care must be the highest priority in any decisions. No nursery is better than poor nursery. It was expected that the extra funded early hours would be processed in the same way as has happened for 3-year-olds. But now that's not the case, and the panel is concerned that parents are unsure now how to proceed, and concerned that parents may have to pay up front for childcare. In my own constituency work, I'm already helping 2 separate families who, through no fault of their own due to changed circumstances, owe a large debt to a childcare provider for wraparound support. Before I heard of this disagreement with the Jersey Early Years Association, I was in discussions with the childcare provider about the possibility of changing the current process so that the income support payment for after school and holiday support could be paid direct to the provider. So to me, it seems that the best way to fund the extra early years provision would be through the NEF, but it may be that the Minister has a much better way, in which case the scrutiny panel, and I expect all States members, would like to know the details. So to summarise, the panel has concerns about the planned route of payment, about the information to parents, about the administration of the service, the expense of the service, and the fact that JEA is not supportive. We have recommended in our budget review that the Minister should undertake an urgent review of the funding rate, along with 3 other recommendations, which are to keep the panel updated, to include accredited nannies, and to look into more flexibility on ratios for childminders. I personally cannot support this amendment from Deputy Gardner because it brings a financial negotiation to the floor of the Assembly, which I don't think is right. I do, however, ask the Minister that he responds to the panel's recommendations, and that even if he has refined an alternative process for providing this provision, he will undertake to personally meet with JEA urgently. Thank you.
Thank you, Deputy. Deputy Feltham.
Thank you, sir. I'm pleased to follow the chair of the scrutiny panel because she made an incredibly important point around not bringing negotiations to the floor of this chamber. I just want to put that in context for other members about what kind of risky precedent supporting this amendment would set. For example, actually the method that the Minister's team has used to come to the proposed hourly rate is incredibly similar to the method that was used to agree an hourly rate for providers that provide care that we fund through the long-term care packages, for example. If we set a precedent today in this debate, in saying that providers can lobby States members and States members will bring amendments and propositions so that effectively negotiations that are being had around costs and funding from government and what specific rates should be can then come to this Assembly. That carries extraordinary risk. I have a number of teams within my department that are negotiating with different providers on a daily basis around different services, whether that be primary care services, as I mentioned, long-term care, or pharmaceutical services. It's really important that the teams that are working on that negotiation can negotiate properly and without political interference. It's really important that we don't give in within this assembly to inappropriate lobbying, which brings such negotiations into the political realm. And I think from an efficiency and effectiveness point of view, we'd be sending completely the wrong message. And personally, I'm really disappointed that this amendment has come from the chair of the Public Accounts Committee, because it sends entirely the wrong message about the way that we should be negotiating with providers. So I urge everybody on that basis to vote against this amendment.
Thank you, Deputy. Deputy Miles.
Thank you, sir. I'd just like to point out that I am a member of the Children Education Home Affairs panel, so I have been working on this with our panel, and I echo the comments of the chair. However, my comments now are my own views. So I don't think this amendment has been brought as an attempt to derail government policy. I see it as an attempt to save it. It's been brought forward because the Minister has not yet secured agreement with the very sector he relies upon to deliver his flagship early years policy. And without the sector's participation, this policy simply cannot be implemented as predicted in January 26. The Council of Ministers say the amendment overshadows a positive policy. But in my view, what overshadows the policy is the government's failure to finalise a viable rate with providers, and its sudden move toward an untested administrative model that places risk on parents and uncertainty on nurseries. This amendment provides stability that the policy currently lacks. Indeed, the Minister now seems to suggest that this is a pilot policy, not a firm policy. So I just wanted to address some of the issues that have been raised by the Council of Ministers. The first one is that the amendment compromises the ability to deliver the offer in January 2026. In my view, sir, the greatest threat to delivering this policy in January is not to this amendment. It's the inability to secure participation from the early years sector, who have unanimously stated that £11 per hour is not viable. I haven't heard from the Minister a satisfactory explanation why he personally will not meet with Jaya. You cannot deliver a universal offer when the universal providers can't afford to deliver it. And the amendment is the solution, in my view, not a barrier. The second issue that's raised is the £11 rate is evidence-based and includes sustainability. The base cost of £10.24 was only that, a base, and the government modelling excluded the cross-subsidisation. Inflation, above inflation rises in food, utilities and insurance, and the sustainability margins. These are not optional extras, they're the realities of running an essential public-facing service. And the government's own early years research report confirms cost pressures and deep sustainability concerns. £11.50 is not generous, it is the minimum workable compromise supported by data and experience. The Minister went on to say that cross-subsidisation is irrelevant. I actually think it's highly relevant. Squeezing that settings that take under twos, which are actually the majority, must cross-subsidise the age group. Squeezing one part of the age range destabilises the entire business model, and sustainability is not age-specific, it's systemic. The comment that market rates show providers are charging less than £11. Those market prices are for full-day sessions, which blend costs across the age group and the hours. They don't reflect the true cost of a ring-fenced government-funded 15-hour entitlement. And government's own modelling, which we've been provided with today, reveals the real cost base. I also want to challenge the issue that direct payments to parents are beneficial. Paying parents in arrears introduces enormous risks. We've heard that families can't afford the upfront fees, although there's a suggestion that parishes and charities should help with that. Nurseries face cash flow instability. Unpaid fees become unrecoverable, and the chair alluded to this. The model already, it's already failed in practice. Providers have been left with significant debts that they can't recover because parents have been paid directly. The administrative complexity will increase. There is going to have to be a new system, and also tax and income support complications arise. So instead of solving the viability issue, the government is proposing to build an entirely new administrative system at a new cost with new risks. And I think that this amendment avoids that by reinforcing a model that already works, the Nursery Education Fund. We're also told that JO was unwilling to accept the offer. JO represents 75% of the early years provision for 2 to 3-year-olds. That's not a few members, as the Minister asserted. If they cannot accept the rate, then it's the rate, not the sector, that's the problem. You cannot achieve a universal offer while sidelining the group that provides the majority of universal care. The Minister talks about leadership, but what about followship? There's no point in leading your troops to the top of the hill if they're not for you. JR are not following you. Parents want affordable childcare, yes, of course they do. But parents won't have affordability if nurseries withdraw from the scheme, fees rise for other age groups, small settings close, and that they've got to pay upfront and wait significant amounts of time for reimbursement. Affordability for parents depends on the viability of providers, and they're not opposing goals, they're inseparable. So what this amendment proposes is actually a very small uplift, which will have a huge impact. For just 137,000, this amendment will stabilise the delivery model, prevent unnecessary bureaucracy, protect families from upfront costs, and actually keep nurseries financially secure. And it will also ensure that the 15-hour offer can be actually delivered across each parish. It's a tiny cost within the £3 million programme, yet the impact could be profound. So I think this amendment is an investment in children, it invests in local small businesses, and it certainly invests in the early years workforce who ensure the quality and the continuity of care to our children. I don't think it is an indulgence, it's a foundation on which the government's promise stands. So, sir, at this moment, I think the Assembly faces quite a simple choice. We can choose a policy that works in theory, or we can choose a policy that works in reality. We can choose to listen to the spreadsheets, or we can choose to listen to JR, the people who feed, teach and care for our children every single day of the week. We can choose the administrative convenience of government, or we can choose the practical realities facing parents and nurseries across the island. We can choose to build a more complicated and untested system, or we can choose to build a better one that already aligns with the Nursery Education Fund. And so for those reasons, I will be supporting the amendment. The amendment doesn't ask for a revolution in childcare. It's a 50p uplift, just 50p, to prevent a good policy from falling before it even begins. It asks for fairness, it asks for practicality, and it asks for partnership. And for these reasons, and for the families that are counting on us, where I've been on the fence for other amendments of this budget, I am quite clearly off the fence on this one, and I am choosing to support it. Thank you, sir.
Thank you, Deputy. Deputy Stevenson.
Thank you, sir, and I'm very pleased to follow the previous speaker who's made a very clear case for this amendment there. I also can't help but feel like there are some similarities here today between some of the discussions and the teacher negotiations that have previously been brought into politics and the floor of this assembly as well. What I wanted to start by saying is, at the beginning of this debate, I did make that declaration that I do have a young child. And so I do see the pressure on the nursery system every single day. And I don't want to go into details about it, but, you know, I see it. I've witnessed it as a parent. And I've felt that, and it is a difficult situation. And I know that, you know, we've seen it in the media, we've seen it with nurseries closing rooms, we've seen temporary closures, permanent closures, people saying that if they don't get enough staff, then they will have to close. As a parent, that's incredibly unsettling and worrying as well. And I've certainly had experiences in the past where there isn't really a huge amount of choice about where else to go. It's not that one provider is struggling, it is a sector under pressure. And this is actually a really vital sector in Jersey. And if it starts to fall down, then lots of other things are going to very quickly follow after it. So I wanted to just provide that insight as well. The other thing I would say, there was some talk in some of the earlier speeches, I think Deputy Jearn and the Minister as well, about parental choice. And if there was a certain amount of money paid to parents, then they would have the choice about how they would go out and spend it. And that's all well and good, and I support that kind of choice. But actually, just stop and think for a moment about what choices there actually really are for parents. Think about things like the location, the logistics. Very quickly, it narrows down your choices in a nursery market that isn't huge in Jersey. Think about, in my experience, and it is a sweeping statement, I won't try to claim any numbers or names to back it up, but having done a lot of personal research for obvious reasons in this area, a lot of the nurseries that tend to charge lower rates also have shorter days. So for somebody working a 9 till 5 day, they can't pick their child up at 2:30 in the afternoon, as some of the more traditional nurseries that are often not-for-profit ones as well, so are able to charge a slightly lower rate. You don't have that choice to go to them. So consider the hours, the location. Then you start to think about what you actually want for your child and the type of setting you want them to be in for. Do you want to be packing a packed lunch for a 1-year-old every day who doesn't really know what they like or don't like yet? Or do you want them to be trying lots of different foods that maybe you don't always have the time to cook for them each morning, or take in a flask and the logistics of that? There are an awful lot of things, some very serious, some very individual to people, that go into making those choices. And actually, the choices really do narrow very, very quickly there. I am concerned, as others have said, about the claim-back system that the Minister is proposing, and I for very similar reasons to previous speakers and to Deputy Gardner herself. I know the Minister has referred to being able to support struggling parents, how parishes sometimes do. I would just say there as well that relies on asking for help. And that is not always easy. And we see that time and time again in all sorts of systems. It relies on somebody being willing to ask for help. And that's sometimes quite a difficult barrier to get across first. I would also just like to take the opportunity, though, to, while we're talking about nurseries, to just say thank you to all of those who are working in this sector. And I often joke to the staff in my own child's nursery that I just don't know how they do it. To have all of those children under their care in one day and give them, in most cases, a very wonderful experience every single day of the week, and then go home perhaps to their own children, but also their own lives, absolute credit to them. In a sector that isn't exceptionally well paid as well, and there are all sorts of pressures. I just think it's important that we recognise them within this debate as well. Finally, and we heard this a few times yesterday, and I appreciate it's the game of politics that lots of people are here to play, but we heard that this is the government that finally has done X, Y, and Z, and finally we're getting this over the line. And yes, this is the government that will get some things done. It will be able to say that at the end of its term and claim certain policies, but we are in the unique position in this assembly today that this is a term of office that has had two governments. And in my experience with Jersey politics, but Jersey more generally, change and new things take time. We don't change in Jersey very easily or very quickly, and often it's a process that takes a long time. And there have been 2 governments in this term of office, and 2 governments that have been working on providing extra funded childcare for parents in Jersey. So just before I finish, I would just actually, as well as thanking from a parent and from a member of this assembly, though, the current team and the current minister and his officers for all of their work on this, I would also add my thanks to Deputy Gardner, his predecessor, and her previous Assistant Minister, Deputy Doublé, who I know worked extensively on this project. Whether it's come to fruition in the same way as theirs would have, I don't know, but the groundwork nevertheless is important. And as I say, change doesn't just happen overnight, so I think this has certainly been a process, and I think I'll leave it there, sir. Thank you.
Thank you, Deputy. Deputy Alex Curtis.
Thank you, sir. I'm a little confused on this one, so I would be genuinely interested in understanding where the difference of opinion is, and if I have made any misunderstandings in how I understand the lay of the land and the policy. Deputy Jeune stood up soon after the Minister and described what I thought to be what the Minister described as well, very similar. I know that what we're describing is 15 free hours, but in some ways it sounds like we're describing 165 hours of cover per week delivered at around £11 an hour. And I conversed with the Minister, I hope he doesn't mind, by email to confirm that, and his words himself talked about flexibility. There could be a chance somebody actually who paid for nursery care at just under £11 an hour would be able to get slightly more. So I'm not too sure why we need universal support from providers as the rate of funding, because this sounds like it's a way of helping parents afford the funding for their education, not fund directly. Mention was made by a few speakers, Deputy Miles most recently, about nurseries withdrawing from the scheme. And again, this is where I genuinely would appreciate people, members correcting me where I am not fully understanding, but I'm not sure where nursery providers interact with the scheme. It sounds like nursery providers provide a service to parents, this was a minister's description, and parents go in arrears and request through the government scheme the money. The minister described a scenario in which nursery fees may charge more and then parents would bridge the difference. And if it is the case that, as Deputy Gardner says, many nurseries would need to set their fees at £11.50 or equivalent, parents are being asked to pay 50p for every hour of the 15 hours. And I don't necessarily see what's wrong with that, sir. The whole intention of the policy is to enable parents to get back to work sooner, to remain economically active, developing their careers, and a cost of 50p per hour for those who choose that kind of nursery would seem to me to be a life-changing amount compared to where the policy is today. I may not understand the policy in full, and if that is not how it works, then I've misunderstood how the Minister described it. So I would appreciate anyone clarifying that. But to put that into perspective, if it was a nursery fee of £11.50 an hour, that is a 95% subsidy on the rate in 15 hours, or the equivalent of receiving, to the Minister's example of reduced hours, 14.35 hours of nursery funding a year. So I genuinely cannot understand how nursery providers are saying that they would withdraw. If this is a case that the funding of £11 is insufficient for, say, half of the nursery providers to cover that, and that they will be charging parents more, I perhaps am actually happy with that. I think this is a very generous scheme. I think it is a good scheme to get money in hands if we want this policy model. And if it means parents are paying £1 an hour for an addition, it sounds like what we're talking about is a life-changing amount. And the difference is by retaining this, it does sound like it's retaining choice. Again, I'm really confused why there's such a difference of opinion over this as to whether this means the scheme won't run or not. It seems a large amount to support parents compared to what they currently get. It's a really big difference in their funding, and it gives choice. I hear a debate about the arrears model. It sounds like work could be done there, but that the fact that we would be retaining a scheme decoupled from what nurseries need to provide the service sounds like it provides more policy flexibility in the area in the future. We may choose that actually a more sustainable model requires 80% funding of 15 hours or 80% of 20 hours, and the way we invoice it is different. Requiring it to rely on the sustainability of 100% free 15 hours at every nursery sounds restrictive. I say all this not being the expert in here, trying to interpret the difference of opinion. So if members could clarify if I am mistaken, that in particular, should nurseries be charging more than the £11, that it would not just be a case of parents in essence bridging the gap of 50p an hour on an £11.50 hourly rate. I would be really appreciative, because I personally am struggling to see where the difference of opinion is, and I don't mind if parents do have to bridge a gap of 50p an hour on what is now going to be a life-changing amount of money to help them back into their employment sooner.
Thank you, Deputy. Deputy Doublé.
Thank you, sir. I'm going to try very hard to collect my thoughts, because I have a lot of thoughts on this. And as Deputy Stevenson mentioned, this is something that is very, very close to my heart. And I was very grateful to be able to lead some work on this area under Deputy Gardner. And grateful still for the current Minister and the current government for continuing that. And I think we shouldn't forget that, actually, is that we're debating a detail of this policy, but actually it's a real win, I think, for this Assembly and for the island that this policy has been created and carried forward, and that there is going to be something, and I think that's really, really positive. I'm going to respond to the previous speaker who had some questions, I think, and one of the things that the previous speaker said was that the main policy intention was to get people back to work. And I just wanted to clarify that that actually was not the main policy intention, certainly not my policy intention. It may be an impact, an effect of funding some childcare hours, but as with all of my actions, the policy intent was to improve things for children and to improve outcomes for very young children. And in terms of optimal child development, around the age of 2 to 3, the evidence shows that some time in a good quality setting, childcare setting, improves child development in areas such as language development, social skills, emotional development, and has those benefits carry on through their childhood and improve their chances of high educational attainment. So that, and I think we must actually remember that when we're having this debate, that we're talking about money and we're talking about profits and rates of paying for this childcare, but the main reason for us actually implementing this policy is to improve outcomes for the very youngest children in our island, and to invest in them at the earliest stage, which of course we do invest in 3-year-olds with the NEF funding, many of whom attend our school nurseries, but this 2 to 3-year-old funding will be solely delivered by private nurseries. And I think that's why it's difficult to get to an agreement, because it's not, we don't have as much control over those private providers, and nor should we, probably. And Deputy Stevenson mentioned the people working in those nurseries, and I have the greatest respect for them, as well as putting forward a voice of children today. I also have experience running a nursery, albeit in a primary school, and it's one of the most rewarding jobs anybody could ever do, and such a privilege to spend time with the very youngest children, and it is very, very hard work, and a lot more specialised than people would realise. Children develop at such a fast rate in those early years, and having a deep understanding of child development is critical. So to come back to the detail of this amendment, sir, 15 hours was chosen because it was the best evidenced amount of time. There isn't precise research evidence on what the precise amount of time would be, but it's around 15 to 20 hours at this age range. In terms of the cost, so I think we must remember that many parents are paying for full-time nursery places. So this is actually just the tip of the iceberg in terms of childcare costs. We know that we have the highest rate of families where both parents have to work full-time, I think, in Europe. So many families are paying some of these rates, which Deputy Gardner has very helpfully provided. I think the average cost of a 2 to 3 year old full-time in a nursery is 16,000, is that right? Yeah. Or 17,000. It's a lot of money. And I do feel for the minister. He's not in the chamber, but I'm sure he's listening in one of the coffee rooms. I do feel for the minister because a lot of negotiation will have been required to get to this point, and I think he's done a good job to get to the point where he can propose something. And to reflect on Deputy Jean's speech, and she was talking about different ways of funding childcare. I think the answer is there is no easy way. And when I was Assistant Minister with responsibility for this area, I was very lucky to attend the British Irish Council on early years and meet all of the other early years ministers from across Britain and Ireland. And because we were at the point of trying to work out how to fund this proposal, I asked them all, and there was not a consistent response amongst them. Some jurisdictions fund their free nursery hours or their funded nursery hours by paying an hourly rate directly to providers. Some pay a capitation rate per child. Some pay a set amount to parents when their child hits a certain age, or when their child hits the school year that they're going to turn a certain age. Some jurisdictions give childcare vouchers. Some jurisdictions run their own nurseries. It is completely different, and I also didn't find a single early years minister at that British Irish Council meeting who hadn't had real difficulties in forming their policies in this area and who were really happy with how it was panning out. So not an easy policy area. One of the deputies asked about providers charging a top-up or parents topping up. I'm not even sure if this is something that's permitted under the terms of this proposition, and I don't know if if there's an assistant minister perhaps who could clarify, but again, that's something that some jurisdictions allow and some don't. And the reason for that is, if you charge a top-up rate, it can limit the accessibility for some families, because there are some families in our island that cannot afford any childcare at all, and are therefore caring for their children themselves. And even a small top-up would actually prevent some families from accessing this who are maybe on the lowest incomes or on income support. And also we need to bear in mind the fact that a lot of families are also paying for full-time hours. So I'm not sure if top-up rates, if top-ups are allowed. So you could limit the choice. So if you have some really high quality nurseries that are charging a kind of chunkier top-up fee, that might limit the choice for families from lower incomes to access those nurseries. And I think what we want is the widest choice and the greatest kind of consistency. And to go back to consistency, so one of the ways that jurisdictions can offer funded childcare hours is by running the childcare establishments themselves. Now, this is something that Jersey does in the kind of the year above the year that we're talking about with the school nurseries. And some parents choose to send their children there. Some parents still don't, though. Some parents do prefer a private nursery. And the reason for that is when you have private providers, you get a greater range of different types of settings being provided. There are some that focus on forest school. There are some that have a Montessori approach. There are some that focus on more formal learning slightly earlier. Very different approaches. And it's important that we maintain that choice at this age. I think it was Deputy Jean asked about why we were doing this lump sum system, and I think the hourly rate is something that has been running with the NEF scheme for the 3 to 4 year olds for many years, and it has worked fairly well, I think. Deputy Miles covered the cross-subsidy. I want to talk about the data, and actually I want to talk about the elephant in the room, which is profit. And Deputy Feltham touched on this because she mentioned how we shouldn't be listening to lobbyists, and I think we should listen to everybody, actually, and I think that we should maintain our core principles. And my core principles are what is best for children, what is best for the very youngest children. And Sarah, I think it is best for the very youngest children in our society that, given our current model of childcare that is provided by private businesses, that we establish a rate and a funding mechanism that allows those private businesses to turn a reasonable profit. Not a huge profit, but a reasonable profit. And I think Deputy Gardner has pointed out in some of the numbers that currently, with the cross-subsidy, the profits available are around 3.6%. Now, you can get that. You can get more than that. I think you can get around 4.1% in a fixed-term savings account at the moment. So why would anybody want to run a private nursery at 3.6% profit? With this 50p uplift after the 4% cross-subsidy, it makes it an 8% profit, which I have limited understanding of this, sir, but I did try to educate myself, and I'm told that this is a reasonable and not an overly large profit margin. I stand to be corrected. I think we do need to talk about profit margins. I can see people rolling their eyes. I'm happy to listen to other views on it. But also, I think we need to reflect on other sources of evidence around what nurseries are providing. And if we look at the ISOS partnership reports, funding must reflect not just the basic childcare, but also additional SEN support. And that report called for a system-wide approach, an inclusive provision, workforce development, funding that covers children with extra needs. And I suppose I'm talking to the nurseries as well. I think if this amendment succeeds today, and there is that little kind of that buffer, I hope that the minister and the providers can work together, because I really want us to have high aspirations for our young children in Jersey, and I know that those aspirations are shared by all of the nursery providers. And to hark back to another, years and years and years ago, actually, the Early Years Policy Development Board, one of the recommendations we made was for qualified teachers in all of our nursery settings, which we have in the States nurseries, but we do not yet have in the private nurseries, partly because they are struggling so much just to get basic staff. And I think that we should be providing those private nurseries with qualified teachers. I think there are many different ways of funding and supporting nurseries to provide extra quality. And I have really considered this because that profit margin, that did concern me, because I don't think massive profits should be made in an industry, in an area such as this. But I don't think massive profits are being made. I would request that the minister, and I hope that he does go and meet with Jaya and listen to them, and I hope listening happens all round, and that everybody keeps the best interests of children in mind, and that also we can be realistic about and be honest, I think, about profits, and perhaps start setting some benchmarks. So I am supporting this today, so I think it's the best chance that we've got, as Deputy Miles said, it's the best chance that we've got of this policy actually succeeding and of it being available to as many of those 2 to 3 year olds as possible on our island. So bearing in mind the needs of those children and my desire to see this succeed, I think that this slight addition of funding to the minister's rate, I think it's reasonable, and I think it's something that members should support. And please bear in mind the best interests of children when you vote today.
Thank you, Deputy. Katie Renouf.
Yes, a few brief comments. I'll echo those who said that the policy is a good one, and to excuse me, that we do need to improve childcare provision, and this will make a significant difference. And I congratulate the Minister and the Council of Ministers for bringing the principle forward. And I also congratulate the scrutiny panel on their robust comments and independence of thought. But I do think it is curious to hear the Social Security Minister and Deputy Catherine Curtis argue that we shouldn't negotiate across the rate across the Assembly floor. In 2023, we will recall that Reform Jersey supported an amendment to the budget from Deputy Catherine Curtis that would have attempted to resolve the negotiations with the teachers' union. It was to, quote, fulfill the required uplift for teacher pay, allowing normal service to resume in schools, according to the report. In other words, the entire point of that amendment was to resolve the unresolved teachers' pay claim. Of course, there were disagreements about that, partly on the grounds that that money wouldn't have been actually enough to resolve the pay claim, which isn't the case in this case of this amendment. So I would say to the Minister that he has had a lot of opportunities to resolve this. The scrutiny panel have managed to meet with the Early Years Association. The Minister argued that he relies on the work of civil servants, and he praises the civil servants for their 7 months of work, and I'm happy to endorse that. I'm sure that they worked very hard, but the fact is that a deal wasn't reached. At some point, it becomes a minister's responsibility. It is surely his own fault that this is being debated across the floor of the Assembly. He has not reached a deal, and he has not rolled up his sleeves to try and make the extra effort to bridge the gap himself by getting involved. I'm looking forward very much to Deputy Mezek's speech, as he's making furious notes to no doubt attack me. So, excuse me. I think the question that the Minister, there was an interesting point that the Minister raised, which was that to implement this amendment would delay the system, delay its implementation. And that's quite revealing, because originally the implementation of this system depended on reaching an agreement. The Minister now says it would be more of a delay if he has to enact this amendment. And that makes it pretty clear, I think, that the Minister has given up on the payment to the nurseries. He's given up on negotiating the rate, and he must have done so some time ago, because he's put all his eggs in the basket of the payment to parents. In fact, it goes even beyond that, because it's beginning to sound as if the Minister is glad he's not been able to come to agreement about the rate. He talked quite a bit about what he thinks the advantages are of the payment system via the parents will be. It's become, I think it's fair to say from his speech, his preferred option. So my central point is the following. In order to save less than £150,000, the Minister is going to set up a new payment system. It will need to vet applicants, check the money being claimed has actually been spent on childcare, check that the right amount is being claimed, and it'll need a payment system. There'll probably have to be some kind of appeal mechanism for parents who feel their claim has been unjustly denied. He also said that there will be extra support for people who cannot afford to pay up front. More bureaucracy. Another system for applying. Consideration of whether those claims are justifiable. Deciding how much support will be justifiable in those cases where people require an upfront payment. And his backstop is that the parishes can help people who can't afford to pay up front. I'm sure that the parishes will be an enormous help, as they always are. But for an early years, the introduction of a new early years policy, that isn't a policy, that's crossing your fingers. At a time when the government is supposed to be saving money, is this really a sensible way to proceed? Is the Minister going to employ new people to do this? Or is he going to take staff who are already employed and presumably busy doing other work away from that work in order to run a payment system? Can the Minister say how much the bureaucratic system he plans to set up will cost. How much will it cost? £137,000 is the amount that would resolve this matter. Is he confident that this new system will cost less than £137,000? He didn't make reference to that in his speech, and I think it is a shame that he has been vague about the costs of this new system. We are supposed to be cutting the cost of bureaucracy. Has the Council of Ministers really interrogated in depth, through its lens of increasing efficiency, cutting growth in government, in the expansion of government, preventing expansion of state functions? Has it really examined this policy through that rigorous lens of its professed determination to stay on top of government expansion? What we have here is a new bureaucracy just to avoid a tiny uplift in the rate, and I cannot understand why it is the case.
Thank you, Deputy. Deputy Bezek.
Thank you, sir. I just want to start by sharing an anecdote from my days as a law student, days that I remember very fondly. I'm sure you had a similar experience, sir, although you were evidently a better student than me because you're sat up there and I'm standing down here. But I remember the session we had where we did some negotiation training, and they split us into two groups. Each got given mock details of a client. We had to nominate a lead negotiator who would go into the room with the person from the other side and try to do a deal. And I got nominated to be the lead negotiator for my team. So I went into the other room and I sat opposite the other person. And I said, oh, well, you know, my client's concerned about this, concerned about that, and their red lines are X, Y, and Z, and we're not prepared to go any further than that. And the person looked at me from the other side of the table in disbelief and went, okay, we'll take that. And in an instant, I realised I just conducted the worst negotiation of all time. I'd clearly gone into it with a wrong plan and wrong understanding of what the person on the other side was prepared to deal with. But that experience does give me two advantages, sir. It gives me the advantage of having learnt from that experience about the do's and don'ts of negotiation, and it gives me also, I suppose, the pleasure of knowing that at least if this amendment does go through today, I'll have the title for worst negotiation of all time stolen from me. Because it really is not sensible, sir, to attempt to have this kind of discourse about what funding we will go for essentially the same product with private businesses out there. And one of the most dangerous things that we can see as public servants, as we are as politicians and custodians of taxpayers' money, is that scenario that you may get from time to time where when negotiating with private profit-making businesses for a service we'd like them to do, to see a negotiation where on one side you have savvy business people and on the other side naive politicians. That is how you get bad value for money for the public. And that is the fundamental flaw in this amendment, because we end up with it, no extra service but pay extra for it, and take away the ability of the Education Minister to lead on this, play hardball when he needs to, be conciliatory when he needs to, but to get the best value deal for the public so that this service can be delivered on. And, sir, I mean, I won't dismantle it too much, but there were some extremely unkind and ungracious words from Deputy Renniff in his previous speech about the way that the Minister has conducted himself in this, but it does have to be said that the moment you put an amendment like this on the table, it becomes impossible to do a deal because they're obviously going to hold out for extra potential funding. It makes it impossible to do that and get people to agree to something around the table and just go ahead with it. So that actually plays its part in any of the things that I think members have wrongly criticised the Education Minister for. So I remember back in 2020, I was the Minister for Children at the time, and I was a member of the Early Years Policy Development Board that produced its report and recommendations, which included the recommendation of an early education offer for 2 to 3 year olds, initially to children at risk of disadvantage, but beyond that, a universal offer. And here we are 5 years later. We're on the verge of being able to deliver it. There were comments yesterday about a do-nothing government. Well, this ain't nothing. This is something that will be absolutely uplifting for the families, children and parents who will end up benefiting from it. And yet it's taken us 5 years to get to this point. And I, for one, think the Education Minister needs to be congratulated for his determination on this. And credit also, sir, to the Chief Minister. I remember in the early days of the formation of this government, when the Chief Minister's attitude on this was, we're just getting it done. No more workshops, no more reviews, no more chasing our tail for years, talking about how lovely it would be to do something, but instead to actually get on with it and do it. And so when there are elements of the providers, it was said before, sir, that the Early Years Association were unanimously not in favour of that. I'm reliably informed that that's not actually the case, and it does need to be said, and they've said it themselves, that the Early Years Association is not a union. It provides a voice for some of its members, but it doesn't operate as a union. It's largely a lobbying group. That the Minister has been tenacious and innovative in his ways to get around difficulties from some participants not being enthusiastic about it, and he has come up with one of those options, sir. And if we give him the green light by rejecting this amendment, from January, people will be able to start benefiting from it. If we provide extra funding, which he doesn't want and doesn't need, it will inevitably end up delaying the implementation of it. Also, an unnecessary amount of taxpayers' money can be reallocated to private businesses, many of whom don't need it. So that is not the way we ought to be going about this. We ought to reject this amendment and support the brilliant work of the Education Minister. And once all is said and done, let's celebrate this as a great innovation in the public service we provide to islanders, and we should be shouting it from the rooftops as something that ought to entice people to stay in Jersey, have their families and children here, contribute economically and add to our general prosperity as an island, because this is exactly the kind of thing that government ought to be focusing on in among all of the other contentious items and often wastes that we see.
Thank you, Deputy. Treasury Minister, do you want to speak on this? Because your light was on briefly.
Yes, sir, I will please, briefly. So I wasn't intending to speak on this, but I do feel motivated to respond to the question about profit margins. And I slightly hesitate because I do have to emphasise that I am in no way whatsoever suggesting any financial manipulation or untruth or any kind of tinkering with the books. But I do just have to make the point that that profit margins can be calculated in many different ways. 3.6% of a small number will be a small number. 3.6% of a large number will be a large number. Profits can be calculated in many different ways. Business owners will take their own earnings in different ways. They may not take salaries, and they may take dividends and drawings from the profits. They may take salaries, which will reduce the profits. So there are lots of ways. All I want to say is that there are lots of ways of calculating profit margins, and in the absence of sight of accounts of businesses, it's very difficult to know how that margin has been calculated and how reliable it is. And I'm absolutely not suggesting anybody's being untruthful or manipulating their books in any kind of way. I'm just saying we haven't seen the accounts, and without seeing the accounts, none of us really have a true and fair picture of the costs of running a nursery and the attendant profits. 3.6% seems to me to be a very precarious profit margin. And I think it would be useful to start seeing accounts of businesses that we are providing money to, so that we all have a fair and accurate view of what the costs and profits are. Thank you, sir.
Thank you, Minister. Deputy Ward.
Thank you, sir. It's always interesting when we get into the private sector, isn't it? And I have to say, Deputy Mezek is sort of red rag to a bull standing as I stand here. Isn't it terrible? Private private profit-making businesses. Whatever next? My goodness me. It's interesting. We can't negotiate. The education minister won't negotiate with the private sector. But boy, oh boy, if it was the teachers' union there, he'd be out of this chamber like the proverbial off a shovel.
That again is unparliamentary.
I apologise. I retract that, sir.
Is it not also, sir, impugning the reputation?
Okay. I withdraw that remark, sir.
Yes.
Okay. Thank you. What unnerves me is that civil servants are telling the private sector the costs, how their business costs. That's effectively somebody coming into my business and telling me what the costs of my business are, and therefore that's how much money I should charge for a cup of coffee. I think it's unbelievable thought process. I'm also nervous about when businesses talk about sustainability, and our Deputy Miles talks about this sustainability. If we don't have a private sector who are, and I'm now hearing 100% of the market of the particular sector, 75% of the market, that's a dramatic amount that's a huge amount of the market to be dealing and taking a punt with. The minister surely has to deal directly with the private sector in these negotiations. As I said, he wouldn't send his civil servants round to negotiate with the teachers' union. I'm sure he would be out there personally doing those negotiations and talking further. And on top of that, by the way, Deputy Mesic talks about negotiating. Does they just walk into agreements with the union and just say, oh, well, if the trade union says that's the money we need to charge, that's the money we need to charge? I don't see much difference between that and the private sector. I appreciate the Treasury Minister's commentary about open books, and I agree. The point is that if the government is doing some subsidy, there should be a bit more transparency in those areas, and I think that's a perfectly reasonable statement to make. But the most important thing is this is about sustainability. This is about having really important, and the fundamentals of all of this is real people's lives, real families being impacted here and trying to get the best deal for everybody. It's not just about families, it's not about the amount the state pays, it's not about the private sector, it's about making it work for everybody. And that's why we need sustainability in all of this. Thank you very much.
Thank you, Deputy. Deputy Lehergara.
Thank you, sir. We all received an email last night at 18:18, and the email, I'll just read part of it. Deputy Gardner will be bringing an amendment to the budget debate which asks for £11.50 per hour. This is below the cost of delivering childcare in a sustainable manner, but it would be accepted by most settings as a compromise. So I have two questions, sir. Where did Deputy Gardner get the extra 50p from, as this clearly still doesn't clarify all of what they ask for? And also, I would like to know how many of the 75% of these organisations will actually be accepting it, that £11.50. Thank you, sir.
Thank you, Deputy. Conor St John.
Thank you, sir. So I probably should start by thanking the Treasury Minister for her maths lesson. So I thought it was great. Sir, I thought she might have told us about the sale value of local businesses to UK chains, but sadly she didn't. So in a previous life, I spent a couple of years working in a school that included a nursery provision. And when I left, I continued for a further 2 years with the school as both a non-executive director and a trustee. So I understand the cost of running a nursery and the prices charged, sir. Sir, we are looking to provide 15 hours free nursery provision. But as I think it was Deputy Curtis said, is it 15 hours at X? Or is it a contribution to 30 hours at Y? Or 40 hours as Z? Sir, it is a great improvement on the current position for parents. So at my weekly drop-ins, I often see young parents who may have issues with the cost of childcare and or housing, and I also see their parents, the grandparents, who also have concerns about their children and grandchildren and the cost of childcare and housing. So 29 years ago, my wife stopped work for 3 months when we had our first child. At the time, she managed a local travel agency. The pay wasn't great, but the perks were fantastic. We were able to travel the world, sir, for next to nothing. So that 3-month break turned into an 8-year break, as we found it far more cost effective for her to stay at home, so rather than to work for pennies as would the case would have been. This proposed funding will give parents far more choice. Rather than returning to work for literally pennies, they'll be able to get back to work with all the social and economic benefits that that brings. So I join Deputy Stevenson in congratulating both this Minister and his predecessor in getting this to a position that we can now proceed. At a time when we are being disciplined in not increasing charges by more than 2.5%, we're being asked to increase something by a further 4% today. So the Minister is proposing £6,270 per child. That is an increase, sir, of £6,270 per child on what the parents would have received this year. I'd say that's a very good start, sir. Let's crack on and review next year. Thank you.
Thank you, Conrad. Does anyone else wish to speak on this amendment? Deputy House.
Thank you, sir. I wish to address some of the comments as Assistant Minister for Education and Lifelong Learning. I wanted to start off with the comments by the scrutiny panel regarding detailed information to parents. Unfortunately, we can't give that until we have an approved budget, but we will respond to the panel's recommendations. And I can assure members that parents will be provided with details of the scheme early in the new year. So the rate that JR actually wants is £12.08, and we understand that Deputy Gardner's amendment is actually a compromise that she has agreed with them. However, this does not stabilise. This, in fact, risks further instability and allows greater influence from lobbying, which is a dangerous precedent and message to send out. To reiterate the point made by the Treasury Minister, we have no evidence of high profits in the industry, and due to the fact that we have no access to the books, we do not have any evidence of what level of profit is being made at all. So, sir, to address some inaccuracies, several members are making assumptions of how onerous it will be to pay parents directly, and also some false assumptions that the NEF scheme is admin-free. In fact, sir, this is not the case. There is a contract that the service providers have to sign up for, and I will read some of this out, actually. So it says, if a parent wishes to access a NEF place with a provider, the provider must ensure the following are completed. That the parent should complete and sign the parent's declaration form, an NEFP01, and sign the child's absence policies. Providers are requested to read through the parent's declaration form and child's absence policy. The providers must verify the identity of the child by inspecting documents such as birth certificates, passports. For immigration purposes, they should check the nationality of the child as well. If the child is not British, etc., etc., etc. I won't go on any further. So it is not admin-free, as some members are suggesting. Providers have not unanimously declined the £11 an hour. In fact, some JM members did accept this rate. And paying parents in arrears, the majority of which already have their children in nurseries and are paying their bills, ensures that this proposal can continue. There's also been reference to this being a pilot policy, sir. This is not a pilot policy. This is a pilot payment scheme. So I won't repeat the points that Deputy Mezek raised around negotiations and the negative comments made about the Minister not doing enough work, etc. What I will do, sir, is I will assure members that a lot of work has gone into this. There have been multiple meetings and an inordinate amount of time has been spent at trying to find a workable solution. Officers have met with multiple providers, including JR, but the Minister has also personally met with JR, and I have been present in a number of those meetings. And it's always been made clear that our door is open and that we are happy to meet. Finally, sir, with my other hat on as Assistant Chief Minister, there was one issue raised around staffing by Deputy Dublé, and I would like to say that I have been able to extend the licensed permissions, to include childcare workers, which I think is a really good example of joined up thinking to ensure that these workers, who are a vital part of our essential services, can also gain better access to accommodation, which hopefully should ensure that they are more likely to stay on island and not leave, and obviously put that sector under undue pressure. So, sir, I think members should, well, I would like to urge members to reject this. There has been an extensive process that has happened behind the scenes. The £11 an hour was not arrived out of thin air, and I hope that members will respect that and reject this amendment. Thank you, sir.
Thank you, Deputy. Does anyone else wish to speak on this amendment? Accordingly, I call upon Deputy Gardner to reply. Deputy Gardner.
Thank you, sir. Thank you for everyone contributing. It was actually a really good, I think, debate. First of all, I would like to say that I'm proud to represent views of the sector that delivering the childcare between 2 and 3 years old. I wouldn't call them lobbying group. It's association that represents 75% of this sector, and they deserve to be heard in this assembly. If nobody else wants to represent them, because they are delivering. They are frontline who delivering the childcare. I told to the members that I really hoped that the minister will meet with them. For 5 days before the deadline of the amendments, I spoke to him and to other members, trying to say, sit down together, find the solution. Somebody mentioned union. Interesting. If the minister would refuse to meet with unions for 12 months before the major policy needs to be delivered. I don't know. It's not easy meetings. It's really difficult conversations, but not to meet with your main provider and to enter into numbers, not negotiation, just to look at the numbers. It's beyond me. Now, another point was raised, and I know that some people commented it's not negotiation. Yes, I think it should be done before, and Minister had more than a year to do this, but he didn't. Some Deputy Mazik said we are custodian of the public money. Absolutely. Deputy Feltham mentioned my role as a chair of the Public Accounts Committee, but actually I'm presenting it as a deputy. But as a chair of Public Committee, if I am custodian of the public money, do we create another administrative burden, the system that doesn't work, that need to check all compliance, payment, refund the payments, or we actually support the businesses, 50p an hour, it support the businesses who are providing the childcare, regardless how we call it. So if we are talking about the value for money, as Deputy Miles said, we have a system that does work for years. We know how the system works. We know that nursery works with the system. We know that parents know how to work with the system. And the only thing that minister needs to do is tomorrow to allow his officers to progress with the system instead of creating a new one. And what is really confusing, Deputy Curtis and Deputy Jean were confused. Do we give this money to the parents and they can choose? But it's not clear for me, between the comments and minister's speech, if on the 1st of January the parents would receive the £660, or the 1st of January the parents needs to find £660 and some time to reclaim this money back. When this £660 or whatever number it is would go direct to the nursery with the system that we have already in place, avoiding any confusion. Yes, the contracts need to be signed, but to deliver seamless, it's the system that was planned. We all received a presentation from the minister back in end of October, and the minister assured us that by 31st of October everything will be signed, the nurseries will agree, and he's pretty sure everything will be fine. The only way that I got really involved, and this is for Deputy Lahagra that asking the question, because since Minister announced at the public hearing that he's going to pay direct to parents, and everyone clear, let's create new bureaucracy, then supporting the businesses, and businesses not sure where they're finding themselves. Yes, I did sit with the businesses, and this is the presentation that you have in front of yourself. And you can see on the page how much businesses are paid now. I'm grateful to Deputy Ranoff and also Deputy Stevenson and Deputy Miles, because they brought, and Deputy Dublin, they brought this clarity, and it's also about the choice. The choice is not big. We have nurseries that find out. We hear parents again and again that they cannot retain the staff. And what another interesting thing, in the common strategic policy around the children, written, we will work with the sector to improve recruitment and retention and intensify training and development of this critical profession. Interestingly, how the 2 years of work with the sector gone. We can debate the remits of the policy. I don't think that we are debating actually the policy today, because I wish we would debate the policy, but what we are debating and the choice that each member of this assembly have, we have 37 independent members. I understand we don't have collective responsibility. I completely respect party responsibility, support the minister, but the question that each member needs to answer to himself and to the parishioner, have I done everything possible to ensure smooth delivery of this policy from the 1st of January? Do I support new bureaucracy, new admin, parental upfront burden and risk, and hybrid rollout and destabilization of the workforce? You can reject this amendment, but if you really truly believe that 137,000 can go a long way to deliver what we need instead of creating a burden, and support businesses who are delivering, and the nursery can operate sustainably and parents not face to put on front, you support the amendment. Thank you, and I call for the appel.
Thank you, Deputy. The appel has been called for. Members are invited to return to their seats. I ask the greffier to open the voting. All members have had the opportunity of casting their votes. I ask the greffier to close the voting. The amendment has been rejected. 10 votes pour, 30 votes contre, and 2 abstentions.
Could we have the 10 and the 2, please, sir?
Yes.
Those voting pour, Deputies Dublé, Gardner, Moore, Balash, Wall, Miles, Renouf, Jeune, Wilson and Stevenson. Those voting contre, the connotables of St Helier, St Brelard, St John, St Clement, Grouville, St Juan, St Saviour, and Deputies Southern, Tadier, Morale, Lehegere, Ayer, Ward, Alves, Gorst, Farnham, Mezek, Coles, Porray, Curtis, Feltham, Binet, Miller, Howell, Binet, Ferry, Kovac, Curtis, Ward, and online, Deputy Andrews.
Close the adjournment.
Members content to adjourn?
Yes, sir. Could you just confirm the First Amendment up after the break?
Sorry?
After lunch, I was just wondering if it is possible to confirm which is the next amendment.
It's the First Amendment, yes. 2:15.